minutes, it will be clear. It will not be there in the surface of the whatever you are putting. If unless it is retained, like in Anjana and Putpaka and Tarpana, we are retaining there for a long time. Then otherwise it will be lost generally. That's why what is happening here is we have to take care of the retention period also. That's why we have put 5 minutes for these things, and we have taken after 5 minutes we have taken the paracentesis, then we taken the aqueous humor in from the this one from the rabbits, and we checked the HP that time HPLC is there. We have taken triphala mean contents, terpenoids, flavonoids, gallic acid, some contents are there. We have taken to HPTLC. Aqueous humor we have taken, and also we have done the HPLC. And
So you have seen all
HPTLC.
the this thing, flavonoids and all that is in that, sir.
Madam,
Active components.
Hi, flavonoids, terpenoids, and
So
these
it
are.
is crossing the.
No, it is not
Not
crossing.
crossing.
Then
Achha.
we will tell how it is not crossing. It's not crossing. That's why if you see this, the peaks of Triphala. Triphala, we have done the peaks. Again, we have done the aqueous humor. The peaks here, Triphala, are not coming in the aqueous humor. See, it's not coming. The things are not coming. Even after 5 minutes, 15 minutes we have given. 5 minutes given. After 5 minutes we have again given once one dose. After 5 minutes again given. Cross checking. Once we may be wrong actually. That's why we have given 3 times. It's not coming. Why it is not coming? How, what to do if it need to become? When we do tarpana same for the rabbit, it will come.
Cross.
We are using ghee as a drops, it may not come. But why? That's why Seka, Achotana and others are used for the inflammatory condition, acute conditions. The most of the things should not require to absorb into the eye. It is not required to go into eye. That's not required. Where it is to be required, the Kriya Kalpa is a different one. We used to use Tarpana and other Kriya Kalpa. We need not use. That's why, what is the justification here is, I will just give an example also. Later we have done some study to develop a drops, the Daru Haridra and Estimuli drops for dry eye syndrome. And we developed taking all these lessons we learned, and we prepared how a drop should to be effective, particularly for disease. If you are using, all may not be effective, but if you are using classical Ayurveda procedures, undoubtedly effective. There is no question of that. When we are changing the dosage form, we have to take care. This is one of the novel idea we are giving. When somebody, most of the thesis from, we can easily develop a drops. It is not a big science now. Anybody can develop
Sir,
a
Arka
drops.
preparation, does it have any? It's only for inflammation.
But Arka, actually, Arkas are given. Arkas, what happen when we do some Arka distillates? It contains lot of things, particulate matters, pH. But what happens when we require an indication Arka is to be used actually for externally? Okay, let it be little irritant, it may be useful. When we are using it for Punarnava, for Chekshusha purpose, you are using. Punarnava for improving vision, we are. Punarnava for improving the absorption, for particularly diabetic retinopathy, and to prevent the degeneration and other changes and edema, papillary edema reduce. It may not be useful because it won't be absorbed actually. If you are putting it, give orally, give some other route. But if you, through ophthalmic route, if you want to give and cross the barriers, but better to, we have to convert into a drops. Otherwise, do tarpana. There is no problem. Then it will be retained. But if you want to use the, why it is required, modern dosage forms also required now, sir. In the clinical practice, some patients may not able to come. We have to address the current day needs also, but without compromising the principles of Ayurveda. That's we will try. We will try to modernize without compromising. We failed many things actually in our experience. Compromising the Ayurveda principles and efficacy is zero.
Yes.
Correct or
Yes.
not? Yeah, being in
We cannot
CCRAS,
get that
our own
direct
experience
result.
I am telling, sir. That's why we need to respect the principles. That is important. Principles are important. These slides, then this tomorrow the concept may change. That's a different thing. Just I am giving an idea, sir. That's whatever I am saying is correct. Somebody.
Sir, my question is regarding endocrisis. Sir, in some cases, if we are including especially pediatric population, then in that condition we have to do some changes in formulation.
Yes, madam.
Like any anjan is explained. Then in that condition we have to do convert in eye drop or any other.
100%,
In
ma'am.
that condition, what should we do?
That we can convert into eye drops, madam. But do the principles really. For example, madam was telling Arca is useful. It will be useful, but its pH will be too much actually. When we are converting some anjana into a drops particularly, we have to do two, three things. One is solubility, and all we will see will prepare the drops. Whatever there in anjana, whatever there in some metals will be easy. The solvent media which is giving in the drops, we are putting a distillate, and it is really coming into antimony compounds are really coming, particularly in the drops. That's we have to check, man. Simply nothing. We prepare the drops, first take an anjana and do the HPTLC or HPLC or gas chromatography, we get the picture. Do the drops and again do it. Really same thing are coming or not. Then it will be useful. If it will be somewhat useful. It's not very expensive now. She's working with you.
No, no, she completed. She's working
Sorry.
in Gujarat.
Okay, Mary, if you want some help doing HPTLC and other things, CCRAS Institute in Jhansi we can help. Some PG thesis or PhD something. If you are trying to convert the anjana into drops or something, we can try
We can
to
use
help.
honey, no, sir. Make it
We can
dilute.
use honey,
Dilute and you can use it.
we can use honey. Whatever media you can use,
Honey is
you can use.
penetrating.
That's fine. But in children, then what happens? Actually, these things are not coming. Actually, then if you see that why it is not coming, what the justification? Madam was also asking. The flavonoids, terpenoids, lot of things will be there. Particularly here in gallic acid, so many things are there. Some steroids will be there. Some steroids are not water soluble. Some are not water soluble. Some are the soluble in alcohol. That's why what happens. These things when we are putting on the eye, particularly as a drops, and these things have the tannins and the flavonoids. Immediately they will react with the proteins actually. Sorry. What?
This is the most important part.
Thank you. This is actually these things when we put on the eye, tear film will be there. Tear film has three components: aqueous media, lipid media, and the mucus. But putting the mucus, particularly, lot of immunoglobulins will be there as a protective mechanism. When we are riding the scooter, we are coming lot of dust and everything pollution. Everything is not absorbed into the eye. It is a natural protective mechanism. Whatever is given to us, that's why what happened. Immediately that will be the agglutination will be there, proteins will react, and molecular size will become big. That will not be absorbed actually. When we are putting immediately, there will be some precipitation. And molecular size, molecular weight of above more than 500, it is not passed through the cornea. It is not required also in Tarpana. Tarpana we are doing for inflammation, acute external inflammation. Why it should go into the eye? It's not required. That's why it is not going. The logic we are doing. That's why the drops when we are preparing for external diseases is a different. Drops we are preparing, that's why. The second point is the second point, if you see the second important point is pH. We have checked the pH of all these Kriya and decoction and all. They are below 5. actually.
देना है
Below
वीडियो
5
बना देंगे
is actually,
वो
below 5 is less
उसके
lipidophilic.
वीडियो वो कहाँ बनेगा?
बना
If the
देंगे ना
acidity,
थोड़ा सा
if
तो
the
1-2 मिनट का
pH
तो
is
होता
less below 5, the
चलो
absorption through
है बना
cornea
देंगे
will
ना
be very
आप बोलेंगे
less.
तो बना देंगे
That's why whenever we are doing HPTLC things, it is not found in the aqueous humor. It is not going into the eye, penetrating the cornea. But it is useful for external diseases. That's fine. That is the pH is not acceptable. That's why it is not generally not absorbed. That is one point. That's very important. That's why higher molecular weight. I have already told the molecular weight above 500. It's not much useful, and particularly it is very tougher actually to be absorbed. That's why the HPTL we have seen nothing is found. And second important point I want to tell is even in the case of even in other grutas and other things we have seen other intervening factors. If you see that the pH I have already told. If the pH is less, molecular weight is less, and if it is not lipophilic, these lipid soluble, these three are very important. Molecular side, lipidophilicity, and this is solubility. These are the important things. These are not complied. It is not much useful for the intraocular infections and others also. Even external infections also, external inflammations also, it is the absorption rate will be particularly less. That's why, and we need to take the trifluglutide and normal gluta. If you see the gas chromatography and HPTLC, there is RF values. If you do pharmacodynamics, you see RF values. RF value will be same. Normal pain gluta if you take it, and after that if we are putting in the eye and taking the aqueous humor, and again we are checking the RF values remain the same. That's why what is happening is the thing is actually the thing which the things which are already dissolved in ghee, lipidophilicity is different from dissolving in the ghee. It is dissolved in the ghee, but it is lipidophilic in the live dish. That is important. That's why lipidophilicity, that's why Gruta is almost, most of the Grutas are lipidophilic. Here, if you are checking the normal Gruta and the Trifla Gruta, RF values remain same. Nothing Trifla content we can see through the gas chromatography. That's why what happens, it is, though it is available, tannins and others give color to the Trifla Gruta. Color will be there. But tannins and other terpenoids will get. The active ingredients, some may not go and may go. That's why these are the various factors which are very difficult to ascertain, particularly.
So APS also, I mean, vitreous also you have taken, like
No,
I've seen.
vitreous we have not taken. Ethically, generally vitreous blood supply will be less, and I don't think we can't. Vitreous way of vitreous introducing the drugs is only give orally or something, or doing injectables, or otherwise are intravitreous approach. You have to do. Otherwise, vitreous have no
So
drug
it's just a
delivery
media.
system. That's why vitreous degenerations, floaters and all treating. It's very, I don't know. Now we have taken a study in particularly floaters of vitreous degeneration. Children, we are observing since 3. It may take another 1 or 2 years to understand really how vitreous degeneration will be. How, madam, that we have not studied, sir, actually. The drugs, Ayurvedic drugs, constant, because blood supply to the vitreous is very less, madam. That's why it is very difficult to see that concentration whether drugs are going into the vitreous or not done. Even in convention also vitreous directly we will do injections, and that's the way of doing this. This is the thing. Then what we have to take care, take the message is here. We have to take various type of dosage forms, whether we are using type of different type of, we are using anjana type of preparation, we are using achotana type, we are using what purpose we are using, which material we are using, what are the indications, That's why when we are developing a modern dosage forms like ointment, modern dosage forms like occusites, sometimes we
Okay,
insert
so
something.
yes.
Eye drops. It contains only two ingredients. Sir. One eye drops. It contains only two ingredients. Sir. One is estimadu, second one is daru haritra. Simple, nothing. Actually, we use it. That's why. What is the principle? Generally, we use the suskakshapaka and other
Ghee
dry
forms, right?
agents.
Ghee. You have prepared ghee.
No, only drops. That's
Achha,
why I am
drops.
telling how, though we are not putting ghee, how it is reproduced. What here, not it is reproduced. What here, not ghee made,
Okay,
not
sir.
ghee, not ghee made,
Okay,
not
sir.
ghee, not ghee drops, ghee, not ghee based. Previously studies, and particularly in dry eye syndrome, we need to wet the cornea first. That is syndrome. We need to wet the cornea first. That is immediately dryness should come down, whatever method it may be. We have to restore the tear film. Second one, we have to improve the corneal health. Continuous tear film makeup will cause the dryness in the cornea and corneal keratitis. Mild type may will develop in the longer thing, very chronic case. Corneal health we have to restore. We have to improve the tear flow. Sometimes tears will be good. Tear contains the aqueous lipid and media. Sometimes mucous lipid media may be deficient in tear film. And these are the various things we have to take care, and we have to understand what is the and how we can address the treatment, how these things will be useful. That's why we have to take what is the underlying pathophysiology, that also we have to very take
Sir,
care.
can you use lip month?
Yes, madam, already it is there. The Gruta is already, madam, Gruta is indicated. I am not telling about how to treat dry eye. What principles we use it in this drops I am telling. But whatever we are telling, Tarpana core indications,
Vasam,
Shushka is
अच्छा कुछ
already
भी use
there.
कर सकते
Dryness
हैं.
is
Yes.
very much indicated. Tarpana and all. It has to be given, man. It can be given. It's
So
not
what
that.
treatment have you used for this Mulati and Daru Hridra eye drop? If it is not there, then what have you used?
It can be used.
No,
That's
sir,
why I am telling.
like you have prepared drop, no?
Drop.
Aqueous
Yeah, that I will
boiled.
show. That I will tell. That's why. That's I told you, na. When it is soluble lipid media, it will be better. I will tell how it is useful. That's why we have to take these principles. I will tell how it is useful. Madam was asking, and you have also doubt. If you are not in Gruta, I told lipid solubility means it is not solving them in the ghee or oil. The nature of the compounds which when we are putting in the eye or we are taking orally, the cell membrane, if you see the cell membrane is lipoproteins, lipids, cell membrane, when any cell, corneal cell, epithelial cell, when it is putting on the eye, when it is putting in the orally, when we is putting on the ear, wherever we are putting, the cell membrane, it need to be crossed means it should be lipidophilic. But when it will dissolve on the eye, if I am putting on the cornea, corneal epithelial cells will be there. Cell have a cell membrane which is having lipids. It is prepared with lipids and lipidopro. When you putting, it should be dissolved in that cell membrane. Lipidophilic means that. But grutas, most of the grutas soluble are lipidophilic. That is there, not all. That's why. That's why I tell how this is useful. Just we have seen. What is the logic? Actually, we have the lot of what is required particularly in dry eye syndrome. One is we have to restore the corneal health. That is very important. Corneal epithelial, keratoid, and all we have to do surface. That is very important. Second point, we have to improve the tear film quality. Aqueous and all contents of the tear film should be good. Then tear quantity also should be good. And sometimes what happens, the conventionally what treatment is going, you can see somewhere on the slide or that what happens here is the carboxymethyl cellulose is used. Many other things are came now also. So many agents have come. But what they are doing, they are having very good wetting effects. Just we have CMC, carboxymethyl cellulose. It is used, we are putting drops 3-4 times a day and it is useful. But what happens, it is the effect is not sustained. We have to use continuously. That is one. Second, it is not restoring the corneal health. It is only wetting. That's all. It is not repairing the damage. Third point, it is also not stimulating the tears. It is not improving the quality of the tear film. But why this is one technique we are using the thing.
At
Second one
some
is
point that will also not work.
that won't work. That's not working. CMCR is not working. Some, if you see the tear stimulants, now nobody is using because of cholinergic drugs. Nobody is using because of other hypertension. Other generally we are not using all those things. Then think the punctal occlusion. Nobody is doing. Actually, if it is dry means if you occlude the punctum, the tears will not be going and it will be retained. That is also not a sustainable method for longer time. What happens now, if you go through the literature actually it requires very good improvement of the corneal health is to improve, and it requires good antioxidant property, and it should also able to prevent the secondary infections in dry eye syndrome. Sometimes dry eye cases, if they go expose little exposure to the environment, immediately they get infections because already there is a
Air.
correct inflammation will be there in chronic
Air
cases
and
and
light.
all. And that's why we have to restore the cornea. These are the two important. That's why there are different factors. There are epithelial growth factors, hepatocyte regenerative factors, and a lot of factors. Epithelial cells, if you see the molecular biology, very good factors will be. These factors are absent particularly in these conventional drugs, but they are useful. That's why we can't say that they are not useful. They are being used. But what we have to do is we have to address these aspects where we have to expect the lack, where what is required for that. Anyway, we are doing Tarpana and all we are doing, but it is useful, and that is known, proved, and some studies are already there. When we are developing a drops which is required by the patient who can use in the office, who can continuously use for the compliance purpose, it is very important that we have to give them to the compliance purpose, and they can use traveling, they can use anywhere, they need not come every time. That's the keeping that way. We developed these drops, and we have done all the required studies of the quality control. We have done the required studies of irritation, toxicity test, and corneal absorption tests. Whatever we discussed today, we have conducted everything, and whether it is really safe. When we are conducting the conventional dosage form into the drops, whether really it is useful. Simply, it is not useful. That studies we have done. That in that study, that's why I have told that. In that I have already told that aqueous humor has three important components: mucin, lipid, and aqueous compound. This we have to restore. I have already told this to you, and this we have to see the components of where the dry eye can be treated, and what is it is very clearly given in the Samhitas also. Asusravanayatra. There is a deficit in the PhD. Asusravanayatra, Asnigdhanetra, Asusravarahitanayatra, Parishishkanetra. It's very clearly told there is a deficit in the component of the tear film, very clearly indicated, and you can see the text, the commentaries, if you see the not the main, it's very clearly indicated. But in this case, what we have to do is, we have to tarpana. I am not, tarpana means it is not procedure of tarpana. Tarpana is an effect. Tarpana, I am telling. Tarpana is a procedure. I putting the tarpana is functions also having tark kapha. We can correlate. The tarpak kapha is not a single component. It's only some aqueous, somebody tells vitreous. It's okay. It is for
overall.
a tarpak kapha is a functional component which manages the
Mucous
whole
membranes,
eye.
everything.
Actually, because if you see the functions of the kapha, that it is bala, it should be antioxidant, it should be immunomodulator, it is antibacterial, it should have a regenerative capacity, and all this we have to restore all this, particularly in this particular disease. The two important drugs I told, that is here is the Daru Haridra and Eshti Madhu. We have seen that is the both are very good actually. If you see the Ayurvedic references, if you take also they are very good anti-inflammatory, where Chakisha, and it is useful in all, and it is also antibacterial, anti-inflammatory effects. Very good studies are available. I think slides you may be giving them,
Yes,
madam?
sir, I'll give
Okay. Then they can read, I think, with the things and all. And these are the very good effects. Then in the, like that other drug also, both have very good efficacy. When we see in the context of eye also, they are very good actually. And that's why, and we have to see how this I took these two things which is available and which is very effective. We have to regenerate the corneal health. That's classical preparation undoubtedly having effect, but tarpana and others, we can't replace those things. But to maintain the if you are giving the patient complaints every time, they may not come, and for that we need to have a safe, effective, and patient complaint method which we can easily carry. And that for that we developed these drops. It's very good. And what we have done is, if you see the components right from the quality and standardization, what we have learned some lessons in the previous slides. I have shown that it is pH should be good, and its molecular size will be good, and all we have studied. Same principles we used in the quality control. And second one is it requires antioxidant and tissue restoration effects. It's required. It also requires the safety. It should not irritate the eye. That's very important. It should not irritate the uvea. Sometimes if you are putting it, if it is absorbed into the through cornea, it will go inside the aqueous, and it should not disturb the tissues. That's all, because we are modifying the doses from. We know we don't have confidence. If we are doing Tarpana Seka, we need not worry about those things. We are developing a new form from that. That's why. That's we checked all the toxicity, quality, safety, antimicrobial activity, and antioxidant activity, everything. And the quality checks we have done here is we checked the standards, everything. And another important thing is the standards of the Ayurveda that everybody will do. It's not a new thing. Any product should be take genuine material. Then some principles are there to develop eye drops and thing. These things are need to be very followed. pH, particulate matter. Somebody was telling about Arca and all earlier. But we have to prepare a distillate and convert into the eye drops. Eye drops is nothing. We are preparing Arca distillates. We are if you see Arca Prakashka, hundreds of Arcas are there. So Netra for abdominal pain Arcas, for cosmetic purpose, for digestive problem. So many Arcas are there in Arca Prakashka by Ravana. It's a very good book. And we are in some Netra Arcas also there. If you see that the Arcas which are prepared for eye diseases, if you prepare in Arca form also, most of them pH is very good, sir. Like eye drops only you can use. Some Arcas like Palashamula, which is used for cataract.
Corneal opacity.
Palasa is botanical name. Buteo monosperma. And it is highly irritant. Some pharmacy in Rajasthan, Kaladi, some pharmacies preparing. It is cataract they are using here, sir. Cataract is very useful. It is immature, incipient cataract is very useful. Palashamularika. That we tried. In fact, if you put it drops, it is very burning actually. It's very burning and intolerable pain, and patients are not taking. That's why we converted Palashamularika also into drops. It is very effective. But Palasa is used particularly. It's beauty of monosperma root bark distillate.
So can we get the medicines which are developed by
Sir.
CCRAS?
Sir,
Can we get the medicines?
the
we-
PE drops
developed by-
we are releasing into the market. You can
Because
take.
you are doing so much
No,
research and
just 2-3 drops we develop. No, you can get it.
PE drops, sir.
PE.
What Punarnama?
Punarnava and some other one more drug. That also, that I will tell you, sir, how you can get information. That we have given these things, the way I am giving you also, because most of you are very young and people, you have a lot of things to do, you can do. That's I am just giving an idea. And but if you want some help, anybody can do. Even madam also can help, and we also can help. And these things, when we do the arka, when we do distillates of Daru Haridra and Estimadu, we checked the contents of Estimadu and Daru Haridra through HTLC. And when we prepare the drops, final drops also, we checked the contents are coming or not. That is important. The contents of distillate also, the distillate eye drops also contain the ingredients of Estimadu as well as the Dadhari. That is very important. Very another important contents we see, and we confirmed that it is coming. And this is the TLC. Then we have done antioxidant activity. Why antioxidant activity is required? Antioxidant activity, I told that it should be anti-inflammatory. Daru Haridra and Estimate is, it is very good, actually useful in the inflammatory conditions and all. It's nether ruja, it is indicating navishan. It's a potent anti-histamine, potent anti-inflammatory, both. But if you see the antioxidant, because you have to restore the corneal health, that is important. We have to restore the epithelial cells of the cornea is need to be, that is important. Then we have done antioxidant, simple studies. Graphs show, looks very big and anybody can do this. Very easy studies.
Published in your journal only, sir, CCRAS journal.
I will, we can give the antioxidant activity. There are 4 simple methods will be there. Anybody you can do. If you are not able to do, get it done from other lab. I think NI also now we are having in vitro facility.
Yes,
Anywhere it's not very expensive. When you are developing a new thing, then antioxidant, the 4 parameters will be there. Nitric acid method is there, DPPH method is ferric reducing method is there. There are 4 important methods you can have. The 4 important methods you can do. This is method 1, method 2, method 3, method 4. Actually, vitamin C and others will be put as a controlled drug, actually conventionally used to improve the vitamin A. Then if we are putting these things, actually, it is potent, having very potent antioxidant activity of the eye drops, number 1. pH is okay, molecular weight is okay, it is passing, and solubility, lipid solubility tested, and whatever hurdles we have seen, particularly in the beginning study, we learned some lessons and we have these things. Then after that, it is found it is very good. Then we try to have toxicity. It is very important. Ocular toxicity. Ocular toxicity means time kitna? Ocular toxicity. Ocular toxicity is one thing that when we put on the eye, it should not irritate eye. It should not go into the eye causing uveitis, iritis, scleritis, and conjunctival chemosis, and it should not damage the retina. Sometimes it absorbs. When absorption is good also, it is not good. Absorption, when it is good into eye, we have to take care of other organs. For example, tarpana seka we are putting, it will not go inside. But when absorption is good, we have to take care of more things because it is beneficial. It is beneficial, and it can be used in other inflammations also, uveitis, for example. Somebody, madam was asking uveitis or something, and it can be used because it is passing through cornea, and the aqueous concentration also will be there. That's why this may be having multiple indications in future. That's why what happened, we checked it in animals, rabbits, and the parameters of ocular simple. OECD 405 is, you can remember, it is a simple protocol, man. Taking rabbits, putting the eye drops every 5 minutes for 5-10 days. Simple, you see, all external only. Pharmacologist say, ophthalmologist अच्छा कर सकते हैं.
Every 5 minutes we have to do, sir.
Generally, madam, to read, because if you give it, it will be. We can ensure. We can once एक बार लगाए से sometimes rabbits उसका sac कितना है मैं बता सकता है. Human वाला भी बहुत cannot accommodate much. That's why we repeatedly we give 3 to 4 times, and that is a method which is generally, and what we can do is we can test whether any redness is there, and whether any inflammation is there externally, any chemosis is there, limbal. Sometimes it will be severe inflammation will be there, and if you see ophthalmoscopy, same ophthalmoscope can be used for the rabbit also, and we can check in
But we
any
can't take a picture. That is the problem.
picture can be taken, but our labs may not having that facilities. We can do that.
One slit lamp also we need for
Slit
the
lamp we
rabbit.
require. Slit lamp we require.
For rabbit and
आप ले सकते हैं मेरे.
नहीं for rabbit.
नहीं, you
उसको भी-
can
अच्छा
take if you
आपके
want.
पास है सर?
नहीं, हमारे पास भी नहीं. आप हमारे फार्माकोलॉजी में ऑक्यूलर टॉक्सिसिटी है मैडम, ये चेन्नई में है. इट्स नॉट ए बिग थिंग टू डू. Whatever shown in the slides looks big, but don't think it is very tough and all. We have done it is a big one. The antibacterial, antifungal studies. Generally keratitis. If you long chronic cases may also be exposed to the fungal, some infections. That also we need to take care. This we have done the antifungal, antibacterial, in vitro, minimum inhibitory concentration studies. I think everybody are doing in PG, PhD studies. Now it is a simple one. And these studies, antibacterial studies, we have studied for the fungal as well as the common bacteria which is used for the for eye. A keratitis, actually when the eye is inflamed, the chances of inviting infections will be very common. That's why we need to take care of those things. That's why we have done this study also. Then it is having very good efficacy particularly. Then we have developed drops of the Darugarigda and Estimatu, both which is satisfying the principles of ocular pharmacology, which are satisfying the basic principles of Ayurveda, and it is safe in animals. Then we have done a clinical study on some around 130 patients with CM, carboxymethyl cellulose as a control. The study I am not giving total. We have given every day for 28 days study we have conducted for particularly this, and followed up for 6 months. And I may not show much actually. We have used visual NROC score for the dryness and other strut leads and other things, and we have used it, and tear film breakup test and other tests we have normally done in other things, and rose Bengal's training we have done. And I will just go through these slides. If you see this, the blooding sensation and foreign body, these are the pricking pain. These are very common, particularly in severe cases of the dry eye. And this we have tested VAS only, with visual NLAC score. And we optimized visual NLAC score. Generally, VAS scores 0 to 10, some picture. But it is generally used for pain and other commonly. But we have to optimize for each one. For example, some patients we have to test run. This is really working, really useful for this. Each thing we have to see, and day one and day, and control group as well as the both we have seen. And after that we have seen the eye also, right eye and left eye. Generally there may not be any much variations. Still we have observed these other squamous tests, rose Bengal staining, and tear film breakup test we have done at 0, 28, and in between also I have not shown. We have done, and it is very the slides just I am showing the efficacy, just I am going glimpse of these things, and how these things are very it is comparable and better than the these drops or the conventional carboxymethyl cellulose. When the drops we are using, it is a one group is group 1 we have done the eyes these drops, the drops. Another groups carboxymethyl cellulose CMC, which is normally used, and doing all the tests, rose Bengal and the trial film breakup test, and clinical symptoms, pain, pricking sensation, foreign body sensation, redness, chemosis. In some patients, redness will not be there. We have checked all the things and analyzed, and seen that this is very comparable. This is better than, when we compare this, better than the carboxymethyl cellulose, and still some few tests we need to do before going into the market. When we are claiming a claim, we should be confident how many days it can be stable. When we prepare a drops, it could be stable at least for 6 months, 1 year. Stability test. When we release into market, it fungus should not come. Stability, it calls stability test that we are doing, that it will come into the market. Because once we release into the market, it should be stable in the शॉप में रखा, बाद में फंगस आया तो इसमें वी हैव टू चेक केयर, टेक केयर दो स्टेबिलिटी टेस्ट वी आर डूइंग. इट इज़ वेल टॉलरेटेड. Tear film breakup and other tests, objective parameters are, it's very it is very clearly evident, it is very useful. Particularly second one, when we stop the medicine also, the efficacy is sustained for some more a few days actually. The reason may be we don't know, we have to see that we are not giving anything orally, or the requirement at least for the patients after 6 months follow-up. When we stop treatment, at least 1 or 2 months in most of the patients, 1 month. Some patients, some few patients more than 2 months. We doesn't require any symptoms, and in them also we have checked the tear film breakup and other tests. The tear film health is well maintained, and corneal health is well maintained. It may be, that's why I am telling the concentration. It is the pH is manipulated well as per requirement, and drug concentration of Daruharidra and estimate we have ensured whether available quantity in there in the eye drops or not. Sometimes pH बढ़ाने के चक्कर में we dilute it. ड्रॉप्स पीएच 3 है तो हम ज़्यादा पानी डालेंगे उसमें, then content of Daruharidra estimate will come down. It will not be effective. We have checked all these things, and it is very effective. And this is one of the good example how the principles of Kriya Kalpas are converted into the modern dosage forms. When we understood that and we use those principles to preparing drops, that will be effective. Otherwise it will not be effective. Either it will be irritant, either it will not effect. That's why this is the principles are very important, sir. Drug concentration should be there.
यदि हम कन्वर्ट करेंगे तो एसिड भी चेंज,
मैडम क्या है मैडम?
यदि हम ये कन्वर्ट करेंगे जैसे अंजन को हम ड्रॉप फॉर्म में चेंज करें तो हमें एसओपीज भी चेंज करनी पड़ेगी.
मैडम चेंज करना पड़ेगा. We have to ensure whatever the contents anjana classically we given, same dose should be delivered in through drops also. For anjana में whatever dose we are giving, उतना dose drops में भी आना चाहिए. Otherwise it won't be effective. Otherwise you have to increase the number of applications of the drops so that the concentration needs to be maintained. बताइए.
So sir, how in our test, angina and acetylcholine and CCRAS described in different way, different part for different purposes. So when we see that in the acetylcholine or pariseka, so basically when we look into the our text and for different regarding treatment for the different diseases of ocular, so we see that most of the they are related to the ocular surfaces, and when we go for the angina and the tarpana, so there is also mentioned the contact time, like how Karl Markra you have to apply.
That's right.
So with the contact, even modern pharmacology describes that contact time is essential.
Yes, sir.
So, even in modern medical medicines, we know that while regarding the research, there are few things like the extent of reach of the drugs, like how much it get observed, and like safety and like cost effective, and there is one more thing, most important thing is actions. So many drugs are described in modern medicine like oxyfloxacin. So they reach up to anterior segment only. So
True.
there are some drugs also. It has good action in anterior segments, but it's not going to act in posterior segment like retina. So there are some drugs like which steroids. low prednisolons like that, predfort like that, drugs which acts on the middle part of the eye, like even external
True, sir.
middle and the retina. They also be prescribed.
Yes, sir.
So action is important. In same way, our pharmacodynamics has been described in our evidence.
Yes, sir.
Yeah, like they have in, the modern pharmacodynamics is like Lekhana, Sodhana, and the Tarpana.
Tarpana.
Yes, this is
True.
our ancient. So why not we have to think on these or our pharmacodynamics?
That's why
Research
I
we
am
have to do.
telling excellently you have told. That's why I am telling we have to. There is no replacement for classical procedures. Wherever we require the patient compliance, the modern dosage. For example, she was telling Anjana can be converted into the drops.
So you
And
will
then,
not give the same.
no. That's why I am telling. That's why I am telling. When the similar therapeutic Anjana is a good procedure, sir. Anjana is a procedure used in different external surface diseases. For Lekana purpose, for Drishtigata Rogas also it is used. When we convert it, that's why I told all the Kriya Kalpas cannot be converted into drops, sir. It's not possible. But that's why in my beginning slide also we have to understand the pathophysiology, we have to understand what is the requirement, desired effect, whether our dosage forms new we are creating really useful or not, all the things. Otherwise, there is no replacement for classical. Second point, the tissue contact time increasing. For example, Tarpana, Anjana as well as Puttapaka, we are giving more delivery. Then we need to have some, if you want to convert them and to use the most patient complex, there is no alternative to it. That I have told in the beginning only. There is no alternative. If you want, if somebody is developing a new dosage form like AccuSats, slow delivery systems, which will retain for long time and deliver, we have to do lot of research on that. I am telling that this is not replacement. When we are doing Tarpana, there is no replacement for it. But here also, when we check it, when the patient is unable to come continuously to us, patient is unable to come repeatedly to us, patient compliance is also important, cost effectiveness important, modern dosage forms also requirement is there to parallelly develop to the classical, not as a replacement, sir. I told in the beginning only. But whenever we are developing such modern dosage form, keep all the principles of the Kriya Kalpas in mind and try to develop whether it is convertible or not convertible. If it is convertible, it is efficacious. We have to see, we have to do lot of experiments whether if it is effective or not. We have to prove. That's why this much of logic we have to use. This whatever he told, I agree. I told in the beginning only there is no replacement for it. Because ocular pharmacology principles are inherent, inbuilt, and in the Kriya Kalpas. Fine, sir. You have told very clearly. The discussion. बताइए. नहीं.
It will take more time, I think.
नहीं बताइए.
नहीं सर, मैं कुछ नहीं बोल रहा हूँ.
Okay. No problem, sir. Something we learn. New point I will get. No, it's good actually to discuss and all. Then I told already that scientific evidence, particularly we require clinical experimental evidence, really how it is having restored the corneal health, how it is reducing the inflammation, how it is replacing the component of tarpa, kapha and all. These are very important that we have, that this study is very effective, and this is a principle, this is an idea I have given you, and how the logic, what is the required, what is need to be taken care and all. Then some more studies you can go for. Just I am putting a glimpses of studies in another presentation, may not take much time. I will tell 2-3 important works we have recently conducted on functional MRI and Nashakarma. Hamster model, how Nashakarma is effective to improve the immunity and respiratory health, particularly in Shalaki, in the eye. And these 1 or 2 good studies we have conducted. Every day if we are using Nashakarma, what is the effect of immunity particularly? Those are very simple 3 studies. So these are some studies. We have done 2-3 types of studies. One I have told is, one type of study is that health seeking trends and epidemiological studies. First slide I have told how we are behaving. Second one, pharmaceutical development. clinical studies. I have told this is a randomized control, may not be useful also. Another one much useful. Another one is the systematic reviews. Is very important, sir. Lot of studies are being conducted in Ayurveda and here are that. We have to have a systematic review studies. If you see WHO document, the experience of the experts is the a level of evidence. If you report the, if you conduct a meeting of experts who are like SAR, we have called and we have CCRAS will be taking like that. Experiences we document and publish. That itself is a level of evidence. Randomized control study, what I have told you, study done, that is a type of level of evidence. But systematic reviews, whatever studies already done, published, if you do a systematic review, it is a simple protocol. We have to, Prospero registration we have to do. Some good studies can be done, madam. MD thesis also, PhD work also. Systematic. What glaucoma we have done systematic review. Conjunctivitis we have done systematic review. Diabetic retinopathy we have done systematic. Allergic rhinitis we have done. Whatever studies, entire domain till 60s or 70s till now, the studies we have taken from sources and done a systematic review and published in a good journal, like Impact Journal, like Trials, and good journals, Journal of Medical Internet Research, and global journals only, except one or two. These systematic reviews are very, it is better evidence than a randomized controlled trial. Sir, it is a better evidence. If our experts' opinion we published, taking a meeting, how glaucoma you are treating, Atimanda you are taken, we published it. And some other studies done by colleges in everything we do systematically, and that is a level 1 evidence. That evidence is very good. That is also equally valid evidence. That systematic reviews we can do, and excellently we can do systematic reviews. Epidemiological studies we can do, and diagnostic tools we developed. For eye we have not developed, madam. We need to do it. Is a complex mechanism. Eye diagnosis and lot of systems. We developed the validity, reliability, clinical methods for skin diseases, respiratory diseases, Jwara, sir, based on Ayurveda, Prameha based on Ayurveda. 5 diseases we developed like Hutchinson's clinical methods we have. We used that type of methods we developed only Ayurveda. It took 4 to 5 years it took to develop the methods. That if anybody is teaching in the ward, a teacher or a clinician, we teach the clinical methods, how to examine pulse and how to. Now we have done health assessment, say like Prakritasana, we developed these clinical methods. Development of diagnostic methods and tools is a different type of research. We started very recently. It is a very lengthy process. Lot of experienced clinicians, consensus required. How they are diagnosing, whether it is correct, it is reproducible. If you do that method, if I do that method, same diagnosis should come based on Ayurveda. That is, sir, that we are trying to have that methods. Clinical consensus, developing of diagnostic tools. Abhishanda, how to diagnose, how to differentiate Vata. That if you develop a method and validate and publish, everybody use same method. Now we are doing based on the classical literature. It is the perception. My knowledge, for example, my knowledge may be not that much receptive to understand the classical literature. If those who better understood will convert into a proforma, I need not think what is the logic behind it. I can mechanically follow it. So this is our goal, sir. Because it is very complex diagnosis. The experienced clinicians will be different perception. My perception will be different. Gauhati, somebody perception may be later. My teachers taught in a different way. My state, I am following this thing. But we have a consensus and do the same method for diagnosis that require a validity, reliability testing. That is having different clinical Delphi method, clinical consensus we have. That is tougher than the clinical study making. And once we develop that method, And again we'll test in a double blind method. We give 100 physicians, same case, they will diagnose whether it is correct coming. And these methods we developed. Prakriti we took 5 to 6 years. Skin diseases and other 5 took more than 5 to 6 years. But I also, we have not done such. We can do it. Then second one, standard operating procedures for Kriya Kalpas and drawing the national guidelines. This also clinical made a project. CCRAS has already invested money and doing the projects. And Tarpana Patapaka Saika Chotananjana Pindi Bidal, we divided. And we are taking literature, we are taking the experts' opinion, clinicians, practitioners from different parts. When they give something, we develop a thing, and again we'll put a meeting when it is coming a common consensus of the developing SOPs. Then we will again give to the different investigators like institute. Some of you also can be investigators, and you can also test whether really it is working or then it will be a national protocol. This method will be very helpful, sir. Diagnosing diseases based on Ayurveda methods. Till that we have to use our own vision to diagnosis. That is the thing.
Sir, what is the vision of CCRS about the surgical and parasurgical in ophthalmic management? Because, to my knowledge, what I want to say, out of 26 type of diseases, 7 are said to be active and 17 are said to be incurable. So total 24 are incurable, and out of that 52 diseases are said to be curable. So out of 52 diseases, only 12 diseases are said to be curable through the medicine exclusively. The rest, 14 diseases are said to be either cured by the surgical or parasurgical procedure. But still, and this is the most debatable matter
Yes.
all over India, because we are facing some trouble from opponent and many there are many hurdles like that. So what are the move of the CCRS regarding it? Why we are not trying to develop our
CCRS is doing some
even
research.
directly makes
Good.
consent in the some diseases. First
Yes.
we have to do incision, first we have to do excision, first we have to do Lekana karma like that. So and after that we have to apply some like Anjana or Sika like that stuff. So what are the move of CCRS like?
Actually, a good question, sir. You have asked. Actually, this is a what we are doing. It is very good, but we have to whatever you told. It should be. It need to be done simultaneously. Good, actually. What now we have taken? We have taken only the standardizing the procedures. How the procedures should be done. That guidelines we are getting. That takes time. But what you told is actually that is only the guideline. When the standard up for panchakarma, for surgical, for parasurgical procedures, agni karma, rakta mokshana, and all parasurgical as well as the preparatory procedures as Kriya Kalpas panchakarma, we have already started the projects, particularly to having the uniform consensus how it is to be given, how it is to be given. That is one. Once the procedures we confirm, it may not take much time, sir. We are now doing in a fast track mode. And when it is confirmed, then we in the disease context, for example, you told that Lekha, Rogas, what is Lekhana, how it, then we have to have different method actually to only take that ethically for each parasurgical procedure. With some disease we need to select. We are selecting some disease also for them, not eye disease particularly, because experts very less in CCRS, particularly we have done others also. I think we have 8 to 9 only Shalaka in CCRS, 10, 19. But but it is very sensitive and all. Then we will do, sir. This is a good area of taking efficacy of parasurgical procedures particularly and standardizing them at what level they are really effective in clinically. That is one. Second one is आप बताए थे औषध साज्या and this one lekana. This is done. Then how much medical management is effective. Some medical management is also given for some diseases, even if surgical. What level, what extent it is useful, that is also very important. That also we need to explore as one of the objectives. Not always cataract, something you may not cure the cataract incipient. But if you are able to, if they are ineligible for surgery, at least you have to improve the quality of vision or you have to improve the progress. Those limitations also we need not always keep for entire cure. That is also important, sir. In allopathy also, most of the diseases not curable, but still they are managing. That's why we have to have the management approach rather than cure. That management, how we can manage is, we can, if we put objectives, we have some answers. The entire cure may be it all claim in many diseases. When they are already told it is not curable. That's good, sir. Good area to be explored.
Sir, in inflammatory condition of the eye, we done with biomarkers. So, sir, which type of biomarker we take?
Biomarkers. Okay, madam. Biomarkers. Very good. Biomarkers is only the efficacy indicators, madam. Efficacy. For example, but in the case of eye diseases, other eye diseases you are asking.
Inflammatory condition like conjunctivitis, uveitis.
Okay, madam. Actually, in that generally inflammation. Biomarkers are interleukins and TNF alpha and some immunological parameters like NK cells and all these things. But when you are trying to understanding how it is really useful, it mechanism of action, if you want to understand, then it is requirement. For simple conjunctivitis and scleritis, when clinically it is reducing, inflammation is reduced. How inflammation is reduced, if you want to understand which pathway, there are the pathways of inflammation. Then you have to use the markers, interleukins, TNF alpha, and post other so many markers, IL6, IL10, so many markers are there. But some immunological disease, scleritis and other things, which is other inflammations which are secondary to SLE and autoimmune disease, we have to use a different type of markers, CRP and so many markers. It is known to everybody. Only you have to use, but they are expensive. But such markers are very useful only if you are doing some rare diseases, like for example diabetic retinopathy. You want to reduce the papillary edema and other things. You want to address the further how it is reducing the edema. That Punarnava, lot of studies done. That is one thing. Second one is in silico studies. Simple one. In silico. Computational studies. In silico studies. In silico studies, we are putting the ingredients of the drugs and putting the chemistry and putting the disease, how disease target. In silico studies we are now doing to understand how the Adharidra is, for example, if we are doing lot of things. But before that we can do in silico studies. Okay, molecular docking study, we have done I-64, so many drugs we have done. How it is acting on the eye system. We have models, madam. You need not cut retina and take markers. You can do the in silico studies in diabetic retinopathy model. Put some drugs, the chemistry and all you check, and it is very simple study. You can do computationally. In silico pharmacological studies we can do how these things are acting. Once you are satisfied, you can go for the study. That is a screening studies in silico molecular docking. I think some thesis also doing, I think here
Yes,
also.
yeah. Animal we have done
In
diabetic
silico
retinopathy.
studies, that require no animals, that require only the drug profile, its chemistry and all you can do. These are some areas how I can put in the next presentation, how we can do this. We can do very good studies from the leads taking from the tribal folk people. Same methods we have used. We have to use the toxicity, we have to use the quality studies, then we have to again check for different diseases. This is the method you can go, and I need not put a lot of things before you. These are some types of evidences I told.
Garam pani.
Simple evidence to the randomized control studies we can use. That's why the parameters we have to use both conventional and Ayurvedic parameters and give the results. It will be more effective. Next presentation I will take over the 20 minutes. In that I will tell you 20 to half
Yes,
an
sir.
hour, whatever
Okay,
time is for it. That I will tell how these methods can be combined and you can write a good papers. Yes.
Okay. We can have tea.
Another phrase.
Ah.
But a good question you have told that parasurgical methods also. We will take some good studies.
Yes, sir.
Good.
Most of us, we have to come the government forward to, prepare the SOP and also to disseminate the draft later to the state government and the official to the state government so that we can try that. Otherwise, what is happening? OPDs are available to the
Second.
parasurgical
Sir,
Second.
the next presentation.
succeed in the ophthalmology of Ayurveda, how to be possible.
Correct, sir.
How could be possible? Because out of curable disease, only OPD disease are how much state is
Sir,
available
बोलो
to the
एक
certificate
मिनट कर दो
parasurgical.
गैप
We are hearing that we have to succeed in the ophthalmology through the medicine.
बैठ बेकार ही तो बोलते हैं बोलो ये
It's very correct, sir.
करेंगे, बोल
It's
रहे
very
हैं,
correct,
आगे
sir.
बढ़ते हैं।
Very correct. We will do it. Whatever possible,
नहीं, अभी
we are trying
उसके
to do
बाद
it.
immediately और एक section, sir.
Not a big procedure. Even it is like that, certainly are there.
11:30
So we have to do only decision and like we have to do.
Yeah, when we do the when we do the clinical consensus, we are doing. We also understood failed many times, and we are trying to do. And example I am telling. We also understood how to do and all, and now we understood what to do well better. Now and we will do it, and it's a good suggestion. It's a good suggestion.
Now, sir, this is my fourth CMA, and what I saw
नहीं
that
बुलाएंगे next time.
from modern science, surgeons are coming, they are delivering their lectures
तुम लोग
and
देखो
for modern,
कितने CME अटेंड किया करके
but nobody has been taking law since in my 15-year career of teaching. I have never seen that any Ayurvedic the ophthalmologist came and they applied to the Ayurveda procedures and they applied angina and later on that. So I have never seen my 15-year career in 4 CME. So this is Lacuna, I think it's a great Lacuna.
True, sir. Actually, the two issues I want to tell before this presentation, there are the 2-3 things. One is policy. Integrative research, integrative health policy is required. But I think you are from which institution,
He's
sir?
from Bihar.
I'm from Bihar, sir.
Very good, sir. Okay, just I am understanding. Actually, क्या है? What is there is an integrative research policy. There the medicine actually there are the for integration. Conventional and Ayurveda are traditional medicine integration. How to you are telling very good how why they are not using and why there is a integrative policy is required. For example, in India there is a system called tolerant system. Actually, allopathy goes and Ayurveda goes. We tolerate them and we tolerate them. Sometimes we use allopathy, they tolerate, they also use it. It is we are going dull. That is one. Second one, some countries parallelly allopathy is being treated, Ayurveda is also being treated. There is no integration. Both are going parallelly. But somewhere, what happens in China and other countries, Vienna, there is an inclusive integrative system. Inclusive मतलब क्या है? Inclusive integration is when a patient comes, patient यहाँ आया, for example, CCRAS में NI में आया. The first I will show in this presentation. What we will do is we will come. Patient को ऑप्थाल्मोलॉजी ओपीडी में आया, मैडम है एक ऑप्थाल्मोलॉजिस्ट बैठा है मॉडर्न वाला, हम आयुर्वेदा साइड हम है. बट इफ इट इज ट्रीटेबल थ्रू आयुर्वेदा, ही विल द पेशेंट हैज टू बी रिफर्ड टू अस ओनली. We don't refer them, and whatever required by us, we will refer them. For example, one small model I give, osteoarthritis model I will give because we are dealing with other diseases also. Osteoarthritis grade 3 and 2, there is only management of pain will be there. Grade 3 up to that they put lot of analysis and some knee this one serum therapy and other sort of they are doing. and knee replacements are sometimes doing in 3 also. In Safdarjung Hospital, we have done a study with WHO collaboration. In Charity University, Germany also done this study. In grade 2 and 3 osteoarthritis, whenever we have done this study on 600 patients, and example I am giving, example only, and what we have done when we published this paper, in Safdarjung, we are sitting, people, most of the integrative setups were there. When grade 1 and 2 orthopedics department, directly they don't treat, go for Ayurveda, they tell. They directly refer, they don't treat it. If, because in the study we have seen total burden of analysis, WOMAC score and all other parameters, and it is KGMC indices, pain indices, everything is better than conventional analysis, and they come for Ayurveda. Grade 4 where surgery is required, they come to us. We also, why to trouble them? If it is unable to, we are unable to, we will try to refer grade 4 for surgery. This is called a cross referral. This type of system is called inclusive integration. Sometimes, this is one example, sir. Wherever we can treat, we have to refer. Second one, cancer. In Tata Cancer Hospital, we started a study. But they treat cancer for them. Wherever we can treat, we are treating. But sleep, quality of life, complications of the radio chemotherapy, and improvement of the digestion and appetite improvements, sleep quality, pain management, they don't give. They refer to us only. Go to Ayurveda, you get treated. Because they are giving their treatment, we are giving our treatment. Wherever we have strength, we treat. Wherever they have strength, they treat. This is called inclusive type of thing. This type of policy is evolving in India, sir. When it is giving a policy level, and there will be no problem for the opponent party, you need not tell. All are same parties, health parties. Now we have.
No, sir, inside this.
Thank you, Dr. Shrikant, sir, for your guidance on research model and practices.
अब
Is
sir-
invaluable to all of us.
अभी सर
After the
question-
evening, sir will be continuing his lecture on innovative areas of research. and
Very good, sir.
science.
Now he intelligently told, you stop discussions and start next.
We have to maintain
Okay, sir, yes.
time management is
No, very good, sir. This is also a part of lecture. 7, 8 slides I have covered. Very good, sir. That's the experienced professor. He profess. हम तो भाषण बाजी देते, आप प्रोफेस करें. Do good, dear. अच्छा है. This is a lesson I will. Good, sir.
Shrikant, sir, I personally request that in CCRAS, one representative must be from every state of the India, sir.
है ही ना सर, हम स्टेट
सब
में
जगह
हैं.
इसमें है.
आप आइए सर, मिलिए हमसे. अभी ये टाइम लिमिट रखा है, ये ट्रेन वैन है. अभी वो
अकेले
करवा
मिलना.
चौथ भी तो कल भी जा नहीं पाए घर. कम से कम आज निकल जाएंगे जल्दी. Okay, fine. The research models. This it is very simple, sir. Don't worry about this language.
Sir,
Only 5 minutes. By the time I come, before complete, they take 5 minutes. Suggested models and frameworks.
चाय पी लीजिए सर.
Madam,
थोड़ा
हो गया.
throat
I
को
had.
अच्छा.
This is extra. Madam, this is a simple thing. You need not worry. That will be last lecture, sir.
सर के 2 लेक्चर हाँ लास्ट.
लंच के पहले ही हो
हाँ,
जाएगा.
हाँ.
हाँ, बस they can be.
वी कैन डिले द लंच. उसके बाद वैलिडेटरी.
Fine, sir. मैं भी निकल जाऊंगा. I requested मैंने जल्दी. These are the models. Some models actually I need not go very detailed, and I can just tell very briefly, and about the how he was asking, and somebody is telling how which models are good for doing research. Not only for every research models are same. 1 or 2 examples I will give for Nashikarma and others also. But what WHO what says, whatever research you are doing, it should be quality should be there, safety should be there, efficacy should be there, rational use should be there. Something.
लाइट ऑफ करना.
Okay, light off.
लाइट ऑफ कर दो. सुनील, लाइट ऑफ कर दो.
But I am simplifying slides. Quality, safety, efficacy, and rational use. These are the very, very important points we have to take care. The whatever research we are doing, these 5 important points. Most of that we are doing the ADRs, ADs, and those who are involved in research, adverse drug reactions, adverse events, we are recording in the research protocol. I think those who are already MD में सब किया होगा, PhD में, I think you are also guiding somebody, you can also know that these are the 5 important. But rational use is a thing, how we can use. For example, we can say the diabetes, example I am diabetic retinopathy छोड़ दी, diabetes, we can treat diabetes well, सब बोलते हैं आयुर्वेद. Which extent we are using, which level तक hypertension we are treating, at which level we can stop, at what level ethically we can treat. That is rationally how we are using our drugs, in which stage of disease, and we are able to, the rational use, if we are able to do, we can position our things globally. Otherwise, what is happening? We told that we have treatment, wherever we go, we have excellent treatment, we use it to tell. If it is excellent, why it is not replacing others? That is the thing. That's the issue. Is the research models, whatever we are doing. He was asking some question about parasurgical procedure. Good. It is very good actually. But we have to demonstrate it is effective through a good study. Then everybody will believe. But if we are able to demonstrate it's a good study and give a treatment protocol, standard treatment protocol, if you publish, somebody, it need not be CCRAS. If somebody publish in a good journal, that will be accepted by everybody. That's why we need to develop a standard treatment protocols for all diseases, including eye and ear, other diseases, rhinitis, all these, whatever important diseases. We never STGs, standard treatment guidelines. How a standard treatment guidelines is to be prepared. If you prepare some guideline, it should be reproducible, acceptable, and uniformly adaptable by everybody in India. That's why. SOPs for procedures, surgical, parasurgical, Panchakarma and Kriya Kalpas may come within 1.5 to 2 years. It will come, a national protocol. When we publish it, it should be everybody should accept it. Everybody, that's why we do, once it is published, when we prepare it, we validate it in CCRAS, again we do external validation like NIA and IA, all bigger institutes, and they will take their opinion. Generally we do it, and we after that we can publish and give. It is a national protocol, and NCSAM is now recommending whatever CCRAS protocols, CCRAS books and everything. When we recommend NCSM, they should be adopted in teaching and all, like Prakriti and others. We should be confident, na? हम कुछ अच्छा नहीं बोला तो सबके ऊपर we can't pressure you use this. But we should be confident. That's why that is a good point he told. We have taken care about the parasurgical process, safety, efficacy, quality, rational use. That is the first slide important. Second important thing we have to is why it is not accepted. What models we should take to accept our studies. That is because we are using inadequate samples. कोई छोटा मोटा studies करते हैं, claim बहुत बड़ा करते हैं, हम वो treat किया, वो cure किया. That parameters, inadequate parameters we are using. Whatever parameters we are using from Ayurveda side, whatever parameters we are doing the conventional side, appropriate parameters should be used. She was asking about biomarkers. Yes, it is to be used actually. When it is to be used, biomarkers, when first I will tell a method how to conceptualize that also, when to do studies. When it is very effective clinically, when a formulation is very good in glaucoma, you are using something, it is reducing the intraocular pressure and improving the visual acuity, and it is further actually stopping the progress and everything, you have checked it. Then when it is clinically effective, then we will invest money on the parameters, how it is working. That time we will see what are the markers, what is the target of your Mahatrifalagrita or Patoladagrita is working at what level, because it is actually acting systemically at what, it is only reduce the aqueous secretion come kar raha hai, or it is improving the absorption of the aqueous and through the system and reducing the ocular pressure, or it is system, whole system itself is improving the method. Example I am giving a glaucoma, which is glaucoma is still not understood. Sometimes if you reduce the ocular pressure also, your vision is going in some cases, chronic symptoms. We don't know how, but if it is directly proportional, reducing the IOP is directly proportional to the, related to the damage, further damage can, it is not, some cases it's not happening. It is a type of internal mechanism which is associated. That where is that pathophysiology is not still understood. Example I am telling, if we are giving some drugs for glaucoma, we have to see all the pathways with good biomarkers. That first it should be effective. Na? The treatment is effective, then we will go. But in allopathy do in a different way. It takes 20 years to develop it, 100 years to develop. But they use a molecule, first whether it is effective or not, seeing path, then go for human study. We have an advantage. We have the aptobadesha. Something is in our hand. We are reversing it. It is called reverse innovation. We know it, but we are testing how it is acting. That's why simple experiences by you also effective. That's why you publish a good case reports. Publish a good case with simple parameters. Okay. It's not, need not be having very good parameters. If you doesn't have parameters, simply if you are reducing, that's all sufficient for us. You go for further studies. Somebody treats, they may not have in fundal photography, just you record it. And yes, publish a case report. And the other method is case series. 10 cases you take. If you are giving some treatment, some disease, some glaucoma, you have got something, and you have the macular edema, cases with macular edema in different diseases if you have seen. If you are giving something, Purnanava or something, if you are reducing the macular edema, you have published it. I have treated 10 cases of different eye diseases where macular edema is one of the factors. How it is reduced? You are giving Punarnava or something, five other 6 drugs which reduce the macular edema. If you are reducing the macular, you publish a case report. When case series, 10 cases you have to, 10 different diseases. One may be diabetic retinopathy, the other one is hypertensive retinopathy, something may be there, some CME retinopathy, whatever disease where papilledema is one of the symptoms. You publish a case, it will be a big news in India if you prepare that one. And then we will check how it is acting. She was asking markers, how it is acting. Then we will invest money on that. Case series ethics committee approval is not required. Case reports ethics committee. 10 cases you treat and publish a case series. 10 treat कर लीजिए 10 में अलग अलग ट्रीटमेंट भी दिया, मतलब नहीं हमें. बट आयुर्वेदिक अप्रोच इज यूजुअली ग्लाइकोमा. अब कैसा बोल रहे हैं हम, 10 केसेस ट्रीट किए, एक पे पटोलादिग्रुत दिया, नशिकर्म दिया, एक इंटरनल दिया, किसी में विरेचन दिया, किसी में पुनर्नव दिया, किसी में महात्रिफलाग्रुत दिया. समथिंग यू हैव गिवन, यू रिकॉर्ड इट एंड शो द एफिकेसी. It is reducing the pressure, it is reducing papilledema. Go back and then publish a case series, then do a pilot clinical study. Then you apply for CCRAS. किसी को फंड के लिए अप्लाई कर सकते हैं. हम 10 केस शीट के केस रिपोर्ट पब्लिश हो गया. अभी we have a scheme called अग्नि, आयुर्वेद ज्ञान नैपुण्य initiatives. If you have very good leads, 10 cases का experience है, you apply us on online, we will call you and आपको सुनेंगे and we will support you some money and we will put our own SRF with you and she or he will record all your cases. Another 20-40 case करेंगे and we will do a bigger clinical trial. That somebody told parasurgical approach. If you have experiences, share us and we will do good things. छोटा छोटा शुरू करेंगे, 10-15 लाख इन्वेस्ट करेंगे उसमें before doing bigger studies. गुड, दिस इज केस सीरीज कम से कम कर लीजिए सर। यहाँ आया जाने के बाद एक एक केस रिपोर्ट 10-10 केस सीरीज कर लीजिए।
But in that
अच्छा।
also they will ask the same protocol, treatment.
हाँ,
Because
ट्रीटमेंट तो हाँ कर
we cannot
सकते
change
मैडम,
in each and every
then
patient.
we can change it. Now there is a adaptive, that's why I will tell my presentation. Adaptive. You can do different treatment to different patients of same disease. For example, glaucoma you are taking. Inclusion criteria, IOP should be this much, he should not having diabetes. Some inclusion criteria you have taken. 10-15 cases, same inclusion criteria. But some will be the pitta prakriti, some is having some other disease, some is having along with some. Each patient you are treating differently. एक तो आछोतन, एक तो वस्ती किया है, एक तो ओरल मेडिकेशन दिया, किसी को तर्पण दिया, किसी को ड्रग अलग दिया, किसी को एसिड भस्म दिया, त्रिफलाचन दिया, वट एवर यू वांट टू. इफ डैमेज इज मोर, you want to prevent, you have given something, and whatever it may be, that you record, and that is called a pragmatic n of 1 trial, I will tell. Then you publish a case, a bigger study. 100 cases आपने लिया ग्लाकोमा का, you treated, but inclusion exclusion criteria plus outcomes what you are examining should not change. बट ट्रीटमेंट एक एक पेशेंट का अलग अलग कर ली थी. ही वाज टेलिंग आयुर्वेदा मेथड शुड बी फॉलोड. समबडी टोल्ड देयर एक्चुअली तर्पण एंड यू फॉलो आयुर्वेदा मेथड्स बट असेस द ट्रीटमेंट आउटकम. ग्लाकोमा में प्रेशर कम होना चाहिए, विजुअल एक्टिविटी इंप्रूव होना चाहिए, फर्दर डैमेज नहीं होना चाहिए. 3 है गोल्स. एग्जाम्पल आई एम टेलिंग. बट यू ट्रीट 100 cases with different medicines and record it, and the Ayurveda approach is useful in glaucoma. हम ट्रीट कर सकते हैं ग्लाकोमा. वन ड्रग वन अप्रोच में फेल. मैंने आपको ड्राई आई का एक ड्रॉप्स दिया, बहुत इफेक्टिव है. समझे? ये तो एग्जाम्पल बोल रहे मैं, इट इज़ नॉट फाइनल. बट सम पीपल अभी 100, 200, 500 में अच्छा है, बट व्हेन यू गो इन द रियल वर्ल्ड इट मे नॉट बी इफेक्ट. मार्केट में छोड़ने के बाद फेल भी हो सकता है. नहीं, जस्ट मैं जो 10 किया, मैं जो किया वो फाइनल मैं बताऊंगा. जस्ट एग्जाम्पल आई एम टेलिंग. And this is type of trials also we can do. In MD PhD thesis you can also do. This is a real world type of studies. That's why this is very very important actually.
जो पर्सनल प्रिस्क्रिप्शन आपका रहता है, क्या हम उसको भी यूज कर सकते हैं ट्रायल के लिए, या इट शुड
ट्रायल नहीं, केस सीरीज के लिए यूज कर, केस सीरीज के लिए यूज कर सकते हैं. वट एवर यू आर डूइंग, यू डू इट. एंड इफ 10 cases एटलीस्ट होने से अच्छा है केस सीरीज के लिए. एथिक्स कमिटी, यू आर नॉट डूइंग रिसर्च, योर इंटेंशन इनसाइड योर माइंड इज ट्रीट. इट इज कॉल्ड इंटेंट टू ट्रीट. ITT बोलते, इंटेंट टू ट्रीट. आप उसको ट्रीटमेंट करना है, ट्रीटमेंट कर रिजल्ट्स मिल रहा है, रिजल्ट्स 10 के मिला, 10 का केस सीरीज कर लीजिए. वो दैट इज गुड एविडेंस मेड. केस सीरीज भी अच्छा है. इट्स नॉट ए बिग थिंग. 10 केसेस का आप हर दिन देखते होंगे, आपको जो कॉन्फिडेंस है 1-2 डिसीज का 10-10 केस का केस रिपोर्ट पब्लिश कर लीजिए. ये कम है, हमारे इंडिया में केस सीरीज पब्लिश होता ही नहीं.
सर वो हम लोग कभी ऐसा लगता है कि नहीं अभी बड़ा इंस्टीट्यूट में है, या हमारा जो गवर्नमेंट इंस्टीट्यूट,
जरूरी नहीं ना, जहाँ बड़ा नहीं तहीं करना है ये केस सीरीज. बड़े में बड़ा कर लेंगे, कोई भी कर लीजिए यार, कोई बात नहीं. अच्छा है. ये तो MP is a big state, you can do big things.
बड़ा स्पेक्ट्रम, छोटी.
Then the thing I just I put
Sir,
one.
may I ask you now? Sir, actually, I would like to do my PG thesis study in a bigger scale. Actually, it was on dry eye. So in that, the parameters were the OSD questionnaire.
It is PhD study.
No, sir, PG study.
PG में बड़ा कहाँ से?
He's from Kerala.
Kerala, sir.
You have already done, na?
Yes, sir. My PG thesis is already submitted, but there were 4 parameters. So in that, all the 3 parameters were gave me a statistically significant result. The 4th parameter was conjunctival impression cytology, but I couldn't find any statistically significant result in that.
How many subjects you have done?
Sir, the sample size was 14.
14.
14 eyes, ma'am.
It's very less, small.
Yeah,
Small
because
sample.
the procedure was a bit expensive.
No, but that is a small
The
sample.
statistician also supported me.
Issue is I will give some few slides. I will do all this answer. There is a
No, sir, my doubt is, I would like to do it in a bigger scale.
bigger scale. That's right.
So can I
Okay.
submit the proposal?
That's why I tell you. When you are doing a bigger study, when you are at least we have a good leads. When we are investing in hundreds of people, it is not money. Patient lives we are doing something, the efficacy which is not convinced.
Yeah, but
That
sir,
when we do in a bigger population, it is called implementation research. For example, I have some drug which is very effective. For example, anemia. We are telling Ayurveda is very effective. We have no evidence. We generated an evidence on 4,000, 5,000 people. Bigger study, the randomized control study. It is improving AIMS के साथ किया मैंने. It is improving at 8 centers, 5,000 patients. 3 grams in 3 months increasing, better than iron folic acid. Where iron folic acid is not improving, also in that cases it is improved. After that, what we have done a implementation research on 70. NIA is
NIA
also
is also
part.
there.
NIA is a part. 79,000 people in 5 states. The states we selected where iron folic acid they तो रहा है बहुत साल, they are giving since many years, there is no change. In that cases it is improving. That is called implementation research. We know efficacy, we are going into the public. That is the large sample study, sir. For that some evidence is required.
Sir, evidence is there. Actually, 3 parameters were there. The first parameter was OSDA questionnaire. Second was Schindler's test, and third one was TM type. So in all the 3 parameters, I got a positive result. The patients.
Duration.
But actually issue क्या है, at least we have to do a good number of study, study then before going to the
Duration,
bigger
how
study.
much you had kept?
21 days, ma'am.
I think that is not sufficient to
Sufficient.
repair the cornea. You have to
The
extend.
second
You have
one-
to
second
take the
one-
study
correct,
to
madam.
2,
Achha.
3, like 1 month, 2 months, or like that.
You have to do little good follow, sir. Follow.
Sir,
That is the rational use. That's why I told rational use. When we are giving, एक बार आप कर लिया, it is useful. But when you are telling somebody, but यहाँ 30-40 लोग, सब लोग वही prescribe करना है तो you have to give some guidelines ना. एक बार 6-3 months use कर लीजिए, 1-2 महीने 1 or 2 months gap is okay, and all these things you have to give. These things, but you require little more study in a bigger implementation research. Conjunctivitis, you can do bigger study. We are doing PE drops. We have done a study in a small group or some 100-200 patients or something. Now we want to do to 10,000, 20,000 in epidemics. That is called implementation research. We don't give any inclusion criteria. Everything is over. Then we are just giving them and seeing whether it is effective or not. In 10,000 people we have given. We seen that इसमें 8,000 patients are कोई फायदा नहीं बोलने से. That is also fail. Because in real world, our treatment may not be effective also.
For any new things learned.
Example I am telling. Where we require real world studies, we are not doing. That's why our Ayurveda approaches are not widely accepted, lack of the real world studies. For example, antibiotic used in respiratory diseases. But trial is done, madam. After that, real world studies, generally doctors तो prescribe कर रहे हैं हजारों लोग. करने के बाद some drugs are failed, they are not useful. वो तो धीरे धीरे
हटा रहे हैं.
हटा रहे हैं. That's why we real world data we need to generate. So that is one. And this okay, I can give answer for that also. Any research, one is methods. Then second one is that is methodologies. That is very important. What is method? What is methodology? What is guideline? What is strategy? These are the 4. It looks similar, sir. We require some tools. हम कुछ काम करना है तो which type of method we have used, which type of rationale we have to use, which type of protocol guidelines we have to use. These 4 are important, and you go through this slide. and how these four can be used also. Many of your questions you are asking. I will just tell. भैया ये थोड़ा आगे जाइए. It may go now. But now, what is the problems we are just facing? I will just tell. What are the methods, methodologies, guidelines, and strategies? But strategy means what is to be implemented. He was asking how to implement this. When we are strategy to implement a treatment, we require a lot of things. What is the thing is, one is methods. Whatever methods we are using, it should be very clear. आप कुछ करो, अब 2 ही पैरामीटर यूज करो, मैं वही स्टिक करो. I am using only 2 methods should be very clear. That is very, very important for us. And there is a bridge between conventional and modern parameters. Sometimes what we are doing, end points. I want to only use Ayurveda end points. For example, when we are generating evidence of the diseases which is very clearly indicated in conventional medicine, the parameters. The endpoints, better to use whatever endpoints you are there in Ayurveda. Endpoint means results. Glaucoma में IOP pressure कम करना, diabetic retinopathy ये, this we have to English. These things are the outcomes. These things, conjunctivitis, these are the outcomes. That's the end point should be very clear. If end points are not very clear, your research is not accepted. Then the other regulations. He was asking, you tell all the state governments, colleges आप लिखिए यही use करना है. That is the regulations. The regulation means the policy should be very clear. Sir, whatever we are doing, we can publish a good paper and you treat in your Ayurveda care. NIA में करेंगे, CCRAS आपका college में treat करेंगे. But if it is to be used by allopathy and all people, we have a policy is required, integrative policy. For example, अभी iron treatment we are successful. When it is published, then health ministry may tell आंगनवाड़ी भी पुनना मंडूर को भी बांट सकते हैं. Example बोल रहा हूँ. That is called implementation. That level we have to reach means we have to done little more work. That your idea is good actually, others also should accept. That is called framework. That is called framework. This only words. Future में कोई, if you go for somewhere, they tell big words. Actually, the words are big, nothing actually. Only that is English words, that framework, strategy. We need to understand nothing inside actually. That's why I am simplifying what we need to do. These are the some issues we need to particularly understand. What are the multidimensional research approaches? Which methods we use? Which type of methods we are using? How we standardize a medicine? Which type of clinical trials we are using? Which type of parameters we are using? How we can use the holistic approach? What are the different domains which are using, particularly we are using for the research, particularly in Ayurveda? Means we can do fundamental type of research on diagnosis. How to diagnose glaucoma, Adimanda, based on only Ayurveda principle. Conjunctivitis, Avishanda, how to do. And what is the treatment protocol? Everything we have to validate and add actually to the generalize, and we have to validate. That is the domains, means that is the diagnostic tools we have to develop. Our own tools we develop diagnosis, then we can do our own tools, we can do research along with the conventional tools are not there. That's why there is a small lacuna in our diagnostic tools also very important. Drug development, I told various things. For example, we are preparing a gruta, we are preparing an anjana, we are preparing other things sometimes. But whenever we are preparing, we are purchasing the quality, really what quality. For example, उसमें कोई एक प्लांट के बदले में दूसरा भी यूज कर रहे हैं. द क्वालिटी, दैट इज आल्सो इनकंसिस्टेंसी इन द क्वालिटी. That is also very important. एक बार आपने महात्रिफला ग्रुता दिया कोट्टकल or somebody I am impressed. Sometimes we use other company. And that may not be effective. Means sometimes it is inconsistency in the quality. That is also we can do some excellent research on that area also. It is very important that then and epidemiological type, social, how people are acting, which diseases really they are accepting Ayurveda. That is a type of things. These are the various models we can really work. Not only clinical research, sir. We can do so many work. In silico works. Method of fundamental research, mode of action. Some treatments are very effective. How it is acting, that is also we can do. These are the different domains of the research, fundamental, clinical, various type of researches we can. There are several research guidelines you can do. Now there is a good ethics. I think you are knowing about GCP. GCP के training कोई लिया है? General good clinical practice training.
I have taken so long.
नहीं आप तो
long.
लिया होगा. Now smart and other studies we are giving colleges को भी फंड दे रहे हैं, पता होगा आपका. स्मार्ट एंड स्पार्क बच्चों के लिए 50,000 बच्चा को 50,000 दे रहे हैं. उनसे भी करवा सकते हैं आप. स्टूडेंट BAMS फर्स्ट ईयर स्टूडेंट को भी पैसा दे रहे हैं 50,000. एंड एक्चुअली स्मार्ट स्टडीज आप कुछ स्टडीज के लिए हम पूछ रहे हैं, आप कर सकते हैं करने से.
But sir, in smart we are getting support from the CCRAS only for the prescribed areas by CCRAS. I think.
But
For Shalakya they are not
no,
providing anything.
we are giving Chalakya also next time. But area wise we are going. Whenever we do Chalakya, we also call for the expression. Because when we do something, na protocol we prepare very rigorously. मेडिसिन भी तैयार रखते हैं, हम भी पूरा देते हैं. मेडिसिन देते हैं, प्रोटोकॉल भी गिव, मनी भी, पैसा भी हम ही देते हैं. आपको बुला के 2-3 बार ट्रेनिंग भी देते हैं. एवरीथिंग SRF भी देते हैं. एवरीथिंग इज हैंड होल्ड. पैकेज दे देंगे हम पूरा. आप इन्वेस्टिगेटर रहिए, बाकी हम पूरा हेल्प करें. बट वी विल डू इट. इफ Shalakya when it comes, you can also express your interest. We will see whether it is eligible, means everything we can give. That's why good GCP training आप हो जाइए कहीं भी. एक आधा घंटे में मैं जो बताई वो that may not be sufficient. Good clinical practice ethics guidelines. He was asking ethics. Allopathy वाला मान रहे हैं. Now a new guideline, CCRAS, ICMR together we have released a guidelines, ethical guidelines for integrative medicine. This is very new. 1-2-3 महीने पहले आया होगा, ये आया है. हम we put efforts. Now when we are doing a study, clinical study, वो phase 1, 2, 3, 4 होता है. We doesn't require any safety, toxicity, allopathic parameters जरूरी नहीं. There is a ethics for integrative medicine has recently released by government. CRS and Ayush is a part, and this is very good for doing the research. Whoever want, and there will be no objection. If we are doing study involving allopathic people also, there is no problem. These guidelines protect us and them also, both. And there are the 3 important guidelines you can download and see what are the general research guidelines. ये दे रहे हैं मेरे slides सबको मिल रहा है ना सबको. Actually this is the template. How what is the drug development? I told quality, how we should do safety, how we should efficacy, how we will do clinical studies. This is the gadgets and the rules. Don't worry about rules and all. When you start working, you know rules automatically. Now we are developing, this is the standard guidelines for other diseases, geriatric and others. We have done some diseases. Eye diseases also we are starting working. Just I am giving you for information. Challenges I have already told. I am not giving much emphasis on challenges, particularly regulation challenges, drug में quality challenges मैं आपको बता रहा हूँ. Capacity building, training. Because we require lot of training. You also require lot of training how to do research. That is also important for all of us. And clinical trials challenges. This I am telling. You are asking how what type of studies we can do. Is I show this is important. From here you should put your attention. But generally what we do, randomized controlled trials are very good. Everybody will tell. RCT करो वो करो करेंगे वो कर, that is only valid. But what is the problem in RCTs? When we are doing RCTs, what are the key issues? RCTs में what happens? RCTs में we do controlled study. We do a drug. It will be vigorous recording will be there. One control group there. One other group is there. When Ayurveda comes, we do an RCT. I have told Ayush DY the Dadi Madhu drops we are given. and we have given CMC, carboxymethyl. That is easy. Both are drops. We have put the label. We have double blind study. We have done. But here, if I am treating glaucoma, for example, randomized controlled trial, थोड़ा कर सकते हैं सर. फॉर एग्जाम्पल, वन इज एलोपैथी ट्रीटमेंट दीजिए ग्रुप को, सेकंड ग्रुप में आयुर्वेदा ट्रीटमेंट, वट एवर यू वांट टू गिव. इट इज कॉल्ड ब्लैक बॉक्स डिजाइन. ब्लैक बॉक्स डिजाइन करना है. आप जो सबको एक ही साइज सबको फिट नहीं करना चाहिए. वन साइज ऑल फिट अप्रोच इज नॉट यूजफुल फॉर आयुर्वेदा. एक साइज कपड़ा लेके सबको पहना नहीं सकते, बस इट्स नॉट पॉसिबल. वन साइड ऑल वन साइज ऑल फिट अप्रोच इज फेल. दैट्स वाई बैक बॉक्स डिजाइन. एक ग्रुप में एलोपैथी दीजिए. हम अभी रोमेटाइड आर्थराइटिस के आई में अभी किया नहीं, रोमेटाइड आर्थराइटिस में एक स्टडी किया. एक में मिथ्रोक्सिन, दैट इज डिसीज मॉडिफाइंग थेरेपी वी आर गिविंग, एंड सेकंड में वी आर गिविंग ऑल आयुर्वेदा अप्रोच. एक ड्रग नहीं, 40 ड्रग है हमें. 40 ड्रग हम रखा रेडी. डॉक्टर पेशेंट को जो चाहिए वो देते हैं. किस में अग्निदीपन चाहिए, थिंगवास्ट थोड़ा ज़्यादा देंगे, ज़्यादा देंगे, बाद में गुगलू, किसी में कैसर देंगे, किसी में दूसरा गुगलू देंगे, वट एवर. बट वी हैव काढ़ा देंगे, किसी में ऑयल देंगे, वट एवर. होल सिस्टम अप्रोच. पेशेंट को वट एवर रिक्वायर्ड दे आर गिविंग. अनदर ग्रुप दिस गिविंग. वी हैव प्रिपेयर्ड प्लेसिबो ऑफ 30 आयुर्वेदा ड्रग्स आल्सो. 30 ड्रग्स का प्लेसिबो भी बनाया, काढ़ा के भी प्लेसिबो, चूर्णा का भी प्लेसिबो बनाया. दोनों को दोनों दे रहे हैं मित्र. बट
In 40 drugs, you are giving few
40 minutes, जो पेशेंट को whatever required.
In that you are going to select.
Well, now, we trained the investigators. Physician को भी पता हो जिसको जो चाहिए, जिसको जो जरूरी नहीं वो नहीं देते. Practical study है. And we after that we results are giving Ayurveda approach versus allopathy treatment. One drug, one approach नहीं. Then अभी क्या किया, पहले हम क्या किया, आयुर्वेद में योगराज गुगलू एंड महानारायण तैला आयुर्वेद में देंगे, एलोपैथी में वो ट्रीटमेंट देंगे, कंपेयर करेंगे. वो हमारा तो मैक्सिमम ट्रायल्स फेल्ड है.
एक ग्रुप
कुछ भी यूजफुल नहीं. एलोपैथी अच्छा हमारा नहीं, बिकॉज हम गलत दिया है, सबको एक ही ट्रीटमेंट दे रहे हैं. बट ब्लैक बॉक्स डिजाइन, दिस कॉल्ड ब्लैक बॉक्स डिजाइन, वो यूज करो, रैंडमाइजर कंट्रोल करो, अच्छा है. पेशेंट सिलेक्शन क्राइटेरिया, पेशेंट को सिलेक्शन क्राइटेरिया एंड असेसमेंट क्राइटेरिया दोनों में एक ही है मेरे. बट हम मेरे आयुर्वेद में उसके लिए क्या करते हैं, बट वी शुड यूज सम लॉजिक मेरे. वी शुड यूज सम लॉजिक. एटलीस्ट रोमेटाइड आम हुआ था पेशेंट, 5 वेराइटी आ सकता है हमारे पास. एक एक्यूट फेज, एक क्रॉनिक फेज, एक बहुत क्रॉनिक, एक में आम सिम्टम्स कम होगा, एक में अग्नि का दीपन होगा. वी क्लासिफाई देम एटलीस्ट 3 to 4 वेराइटीज which is commonly seen in the practice. वो इसको ये जरूरी होगा, इसको ये जरूरी होगा, इसको ये करेक्ट भी नहीं हो सकता है. रियल पेशेंट आने के बाद आपको पता चलेगा इसका अभी अग्निदीपन हुआ तो और 10 दिन दूसरा ड्रग चेंज करे, हिंगवास्ट करने चित्रगादिवटी चेंज करो, अग्निदीपना के लिए व्हाटएवर यू आर यूजिंग, गुगलू अलग यूज करो, एक गुगलू में एफिकेसी ने दूसरा दे दीजिए. बट वी then this is a real world treatment, pragmatic trial. आई में भी ऐसा करते हैं, ENT में भी ऐसा कर सकते हैं. that is one. second one, diagnostic criteria. diagnostic criteria हम आयुर्वेद एलोपैथी में we have the conventionally diagnosis है. ग्लाइकोमा में ये ट्रीट करेंगे, डायबिटिक रेटिनोपैथी और these are the outcomes. hypertension, retinopathy, these are the outcomes. Example, these are the adverse effects. किसी में हम ट्रीटमेंट कर रहे हैं, न्यूवास्कुलराइजेशन ज़्यादा हो गया, ब्लीडिंग हो रहा है, वो भी एक एडवर्स है, वही इट इज़ है. एग्जाम्पल बोल रहा हूँ. बट द सिम्टम्स, वट एवर सिम्टम्स, एंड पॉइंट्स, वो एग्जाम्पल है. इसमें एलोपैथी में कुछ सेट सिम्टम्स है, पॉइंट्स है, वो लेना ही लेना है. आयुर्वेदिक वे है, वो रिकॉर्ड कैसा करेंगे, कुछ रिकॉर्ड करना मुश्किल होता है. वो पेशेंट रिपोर्टेड आउटकम्स, ए न्यू मेथड के वी डेवलप आवर ओन प्रोफार्मा, व्हाट पेशेंट इज टेलिंग वी विल रिकॉर्ड. इफ मोस्ट ऑफ द पेशेंट्स आर टेकिंग सिमिलर रेस्पॉन्स, PROMs, patient reported outcomes. itself is a parameter, simple. वो आयुर्वेदा साइड से PROM यूज करेंगे, बहुत अच्छा है, कोई मना नहीं करेंगे। आपका PROM, पेशेंट ये बोल रहे तो लिखेंगे ना, गलत नहीं बोलेंगे मुझे। बट आफ्टर सम डेज इफ यू कीप रिकॉर्डिंग, PROMs बिकम ये क्राइटेरिया फॉर फ्यूचर। हम वो करते नहीं ना हम।
So daily in OPD we can.
Ah, anywhere, madam. Any disease, any disease. That is a simple diagnostic thing, madam. These are sometimes what happen in a bigger studies. What we are doing a bigger studies in a bigger, we are doing in Vallabhgarh one geriatric study. उसमें सब है, आई प्रॉब्लम है, ENT है, घुटने का दर्द है, पूरा है। जेरियाट्रिक हेल्थ में पूरा कर रहे हैं मैडम। टोटल विलेज को अडॉप्ट किया, उसको अलग अलग पैरामीटर, एन ऑफ वन ट्रायल। आई तो हविसी हम पेशेंट को ट्रीटमेंट दे रहे हैं। एक्चुअली वी आर गिविंग ट्रीटमेंट ऑफ ग्लाइकोमा फॉर 100 or 1000 पेशेंट, डायबिटिक का दे रहे हैं। ईच पेशेंट को वट एवर यू वांट यू आर गिविंग, बट वो CBPR बोलते हैं उसको, कम्युनिटी बेस्ड पार्टिसिपेटरी रिसर्च। नाम बड़ा बड़ा होता है सर, बट डोंट वरी, हम करते रहे हैं ये सब। एक्चुअली हम डोंट वरी अबाउट अब्रिविएशंस ना। हाँ, इसलिए बोलने के लिए मैं लिख के आया, आपको बोलेंगे आप पढ़ लेंगे करके। CBP कम्युनिटी बेस्ड पार्टिसिपेटरी रिसर्च क्या है, हम एक कम्युनिटी में कर रहे हैं। वी वांटेड टू बिग ट्रायल इन ड्राई आई सिंड्रोम, 100 or 500 10,000 कर रहे, वो तो हम दे रहे ट्रीटमेंट, हम कर रहे हैं। वट एवर वी आर डूइंग मंथली, 2 मंथली, 3 मंथली, हम हर बार वो कर नहीं सकते। बट CBPR में हर पेशेंट को हम देखते हैं, हम ट्रायल में इंक्लूड हो गया। बट सम पेशेंट्स व्हाट दे विल टेल, हमारा सैंपल साइज 5000 है एग्जाम्पल, इस ग्रुप में ये दवा दिया है, दवा। समटाइम्स सम पीपल विल नॉट रेस्पॉन्ड। एक विलेज वाला एक बड़ा ब्लॉक को लिए, एक विलेज के रेस्पॉन्स ही नहीं रहे, यू चेंज द ट्रीटमेंट। वो उनको ही पूछ रहे हैं,
प्रकृति
उसको ही पूछ रहे हैं, इसको रेस्पॉन्स नहीं आ रहा है तो ट्रीट और रिकॉर्ड कर लीजिए। N of one trial, I will tell how to do that, that we are doing. After 6 months or 8 months, 1 year, we are changing treatment for some patients. Beginning में जो दिया वो नहीं दे रहे हम, किसी को रेस्पॉन्स नहीं हो रहे तो दूसरे में ट्रीट कर रहे, कोई ग्रुप भी चेंज कर रहे, ग्रुप 1 को ये ट्रीटमेंट दे रहे, दूसरा को दूसरा, पूरा चेंज कर लिया। We adjusted, that is called adaptive trial. Adaptive trial सर, नो एलोपैथी में भी यही हो रहा है, वही एलोपैथी में ये ट्रायल्स हो रहा है। एंटीबायोटिक्स आर नॉट वर्किंग सर मेनी प्लेस। कोविड में क्या हुआ किसी को पता नहीं, तो अपने आप ठीक हो, वी कांट अंडरस्टैंड बट फ्रैंकली स्पीक, नो वायरल डिसीज। एंटी हेलमिंथिक सर, आइवरमेक्टिन इज यूजफुल। कैसे यूजफुल है, वो पहले मैकेनिज्म ऑफ एक्शन किया था इन सिलिको में, कंप्यूटर वो थोड़ा टारगेट पकड़ रहा है कोविड वायरस का, सब बता दिए, सब लोग खाने लगा। हम एग्जाम्पल, बट एग्जाम्पल हम वैसा नहीं कर रहे, एफिकेसी टू वो कर रहे हैं। बट इसलिए है वो N of one टाइप ऑफ ट्रायल इज वेरी इफेक्टिव। एक्चुअली वी आर अडॉप्टिव क्लिनिकल ट्रायल बोलते हैं, अडॉप्टिव का ट्रायल। एक बार क्लिनिकल ट्रायल शुरू किया मैडम हमने, MD में भी PhD में भी ये कर सकते हैं। आफ्टर 1 year व्हाट हैपेंस, इफ यू आर डूइंग वन ड्रग वन ट्रायल अप्रोच, 1 साल के बाद ना जेरियाट्रिक हेल्थ में जनरली फेल होते हैं। आयुर्वेद कोई यूजफुल नहीं सर, मेरा दर्द ऐसा ही है वो। बट हम क्या कहें, मात्रावस्थी जिसको देना उसको दे रहे, मात्रावस्थी जिसको चाहिए उसको दे रहे, जानवस्थी जिसको देना दे रहे, जिसको जो सूटेबल है इफेक्टिव वो देते रहने से 1 साल के बाद हम आउटकम्स मेजर कर रहे हैं, डिजेबिलिटी आउटकम। यार आयुर्वेद में से बहुत अच्छा है, हमको नींद अच्छा आ रहा है, पेन कम हो गया। CBPR कम्युनिटी बेस्ड पार्टिसिपेटरी रिसर्च, या ना दैट उसका प्रोटोकॉल बनाना थोड़ा टफ है सर, ट्रायल करना भी टफ है। वन ड्रग वन अप्रोच ना, वन साइज आर्ट फील अच्छा है, एक दवा बता दो सबको लगा दो, ट्रीटमेंट इफेक्टिव बाद में देखेंगे, वो सूटेबल नहीं सर।
लेकिन सर जैसा आप बोलते हैं ना, हर आदमी अलग है,
इसलिए हर आदमी के लिए अलग ट्रीटमेंट, इसलिए है ना, इसलिए ये कर एक अभी हम भी यही इसी में ग्लोबली यही कर रहे हैं, ग्लोबली यही कर रहे हैं, रेस्पिरेटरी डिसीज को अलग अलग चीज़। दिस वेर N of one trial is effective, this is very good, but these are some pragmatic real world studies, this is another type of studies। आप देख हर एक को एक सोल्यूशन है हमारे पास। राइट साइड whatever we are doing we have written. Left side there is a solution. अब ये टेबल एक बार
सर, आपने
पढ़िए.
इसका कुछ हमको वो दिए हैं क्या एग्जांपल, जैसे एक रिसर्च पेपर
वो इसी में इसी में है सर, मैं दिखा रहा हूँ.
हम बाद में देख
बाद
सकते
देख
हैं
आई वाला एग्जाम्पल्स कम है, बाकी
हाँ, बाकी
एग्जाम्पल्स
समझ में आना चाहिए।
देता. आई वाला हम किया नहीं, बट करेंगे. आई में भी करने में कोई कंजंक्टिवाइटिस एपिडेमिक आता है 10,000 उसी में करने में क्या प्रॉब्लम है, कर सकते हैं. एलर्जी कंजंक्टिवाइटिस स्प्रिंग कैप,
मल्टीसेंट्रिक ट्रायल्स होता था
ये
CCRAS
मल्टी सेंटर एक बड़ा विलेज को ही अडाप्ट
हाँ,
करेंगे.
नहीं पहले होता था आई में
अभी भी कर
अभी-
रहे हैं मैडम, अभी भी करेंगे मैडम. विल डू स्मार्ट में देंगे मैडम, आपको देना ही है, दे देंगे. बस वी गिव हुएवर इज अदर्स सर. चालक जहाँ अच्छा है वहाँ दे सकते हैं. थोड़ा मिनिमम फैसिलिटी चाहिए, थोड़ा स्लीट लैम्प थोड़ा
वो
मोटर
सभी
चाहिए. यहाँ तो है मैडम, बाकी हुएवर इज हैविंग यू कैन डू इट. दीज आर सम एग्जाम्पल्स आई एम गिविंग, and some more examples I will give. These are the studies you can see. Ethnographic studies. Generally आप कोई ट्रीटमेंट कर रहे हैं, आप अच्छा कर रहे हैं, वो पूरा हम रिकॉर्ड करेंगे, केस सीरीज बनाएंगे, आपको बताएंगे. इथनोग्राफी केस सीरीज बनाना बहुत अच्छा है सर. यू डू वॉट एवर यू, हम भी करते हैं. अभी लखनऊ में कोई ट्रीट कर रहा था कोई डिसीज के लिए, छत्तीसगढ़ में कैटरैक्ट में ट्राइबल्स, हम गया इथनोग्राफी स्टडी किया, करते रहे. वी आर डूइंग सम इथनोग्राफिक स्टडी सर. वेरी गुड एग्जाम्पल फॉर पर्टिकुलरली दिस केस सीरीज, केस स्टडी मैं आपको बताया भी है ऑलरेडी. देन इसके बाद कॉन्सेप्चुअल थियोरिटिकल फ्रेमवर्क, ये बहुत इंपॉर्टेंट है सर. फॉर एग्जांपल इफ यू आर ट्रीटिंग ए डिसीज, एक फ्रेमवर्क आप मन में बनाइए. बस दिस इज द पैथोफिजियोलॉजी ऑफ ए डिसीज. अर्म को ट्रीटमेंट करना, अर्म का ये पैथोफिजियोलॉजी है, ये डिजेनरेटिव है, इसको ट्रीट करना है तो ये करें. यू डू ए थियोरिटिकल फ्रेमवर्क एंड दैट इज कॉन्सेप्चुअल फ्रेमवर्क. पहले आपका कॉन्सेप्ट क्लियर है. ड्राई आई सिंड्रोम मैंने बताया, इसमें कार्नियल हेल्थ इंप्रूव होना है, टीयर फिल्म हेल्थ इंप्रूव होना है, एंड दिस कार्नियल एपिथेलियम अच्छा, टीयर रिस्टोरेट होना है. व्हाट आर द वेरियस पैरामीटर्स, एंटीऑक्सीडेंट एफिकेसी होना है, सेकेंडरी इन्फेक्शंस को प्रिवेंट करना है, इफेक्ट लंबा होना है. ये सब मन में एक फ्रेमवर्क, तर्पक कफा, इसका फंक्शन थियोरिटिकल फ्रेमवर्क बनाइए. बट आयुर्वेदिक थियोरिटिकल फ्रेमवर्क बनाने से तब यू कैन डिजाइन योर रिसर्च. वो कॉन्सेप्चुअल फ्रेमवर्क बनाने के बाद आप ट्रीटमेंट करना शुरू कर लीजिए ना, बिकॉज देर इज नो सेट ट्रीटमेंट. आदि मंद को क्या ट्रीटमेंट करना बुक में कहाँ होता, कुछ लिखे है, बट यू हैव टू हैव योर ओन. पर्टिकुलरली शालाक्य में प्रॉब्लम है सर, बिकॉज very simple lines they have given, treatment principles, very simple diagnostic features, and to translate it, understand it and design a study में थोड़ा दिक्कत है. इसलिए शालाक्य के ज़्यादा conceptual framework चाहिए rather than rheumatoid arthritis. तो उसमें बहुत है already.
if we have designed any framework, then how we have to approach?
Then when we design a framework, start doing case series मैडम. 5-10 केस को वो फ्रेमवर्क मन में रख के करिए, पब्लिश करो. देन योर फ्रेमवर्क इज वेरी एक्सेप्टेबल. देन यू पब्लिश गुड पेपर विद इन 3 to 6 months. दिस इज माय कॉन्सेप्चुअल फ्रेमवर्क. वो वर्क को भी पब्लिश कर सकते हैं मेरे. इफ यू डू योर कॉन्सेप्चुअल फ्रेमवर्क फॉर मैनेजमेंट ऑफ ग्लाइकोमा, इफ यू पब्लिश इन जर्नल, मैं भी पढ़ूंगा, आप भी पढ़ेंगे, आप भी पढ़ेंगे, कुछ तो बोलेंगे, मैं भी आपको रिप्लाई देता हूँ, यार ये गलत है, ये तो है, आपको एक्सेप्ट करना है. मैं गलत लिखा तो मेरा सोच वो था. दैट वाज माय थॉट.
It's a good idea or good energy must be supported by some financial support and also administrative support.
100% सर. आपके लिए थियोरिटिकल फ्रेमवर्क के लिए यू हैव टू यूज योर ब्रेन. केस सीरीज के लिए जस्ट यू हैव टू सिंपली 5-10 केस को इतना आप ओपीडी में कर लीजिए. थोड़ा कुछ करना पड़ेगा यार, पर्सनली भी कुछ करना. ऑल इंस्टीट्यूशंस में मुश्किल है पैसा.
बहुत अच्छा रिसर्च हुआ है सर, शायद आपकी नॉलेज में होगा. डॉक्टर नरहरि फ्रॉम केरला, कासरगोड, वन फाइलेरिया trial has been integrative approach of
Sir, I will tell you that is supported by CCRAS.
I know, we have seen that.
Bill and Melinda Gates,
बैंगलोर में
वो
चल
तो
रहा
है,
है,
लखनऊ में भी किया हमने.
लखनऊ में बहुत अच्छा है.
बेगूसराय में center.
अभी भी
I established that center.
Good, sir.
And then Dhiman sir called me that it was pending for 2 years in Bihar government. So he Dhiman sir called me that
Bihar में.
since last 2 years just you do something for him. So I did and established and maximum number of the patient of malaria admitted in that, more than 1,000 patients, madam.
Yes.
Still they have established their own private center in Bhagalpur and it is running. और बहुत अच्छा है ये उसका जो प्लान था एक उसको ट्रक पे और इससे लाया गया था वो क्या कहते हैं जो उसको क्या बोलते हैं
अच्छा इतना बड़ा था
वो जो मशीन होती है जिसको खाता है
ठीक।
ट्रेन से उठा के लाया गया था और उसकी
मैडम ये वेरी गुड सर, आपने जो बता रहे थे एक्चुअली इट वाज सपोर्टेड बाय CCRAS
लखनऊ में
beginning
काम।
when it was started 20 years or 15 years before. We have done a study in Belgaum. Actually, Belgaum and North Karnataka we have done, and it was published in a good journal. After that, based on that publication, Bill Gates Foundation,
Clinics also they have
CCRAS
different
also
design of
supported for
CCRAS.
that. Lucknow we supported it. But our job is CCRAS, we have managed, we have developed a good protocol, integrative protocol, and we support anybody we will support, sir. That's why I am telling whatever CCRAS is doing is not, whichever is published, which can be, that is if government public health system adopts it for filaria. Now we developed another drug, ISL, for morbid cases of filariasis in 5 states, Orissa, Bengal, Bihar, some other 2 states, coastal Andhra Pradesh, where that is there. Filariasis is there. Kerala. I think then we have morbid cases of filariasis. That is also ISL. We have developed. That is also coming into the market. But that will be only limited market we have. That will be through supply to because filariasis is now not a big public health problem in the country. Only few states we have, at least 8 to 10 states it is there. That is good. That similar approach is required here also. That's why that is called implementation work now. It is work, research is over. Now we are implementing on the page. That's why research और कुछ नहीं कर रहे. It is effective, we are doing it. It's a good example. That's ethnographic studies, theoretical framework, it is also important. And the observational studies, I told you, you need to do that observational study models, that is also very, very important. These are some good examples. I just adaptive trial. I told adaptive trial. I will show one slide how to do adaptive trial. Pragmatic studies, practically whatever you are doing, real world. That is, we are recording. That's why I told example of rheumatoid arthritis. Whatever we are treating, we do and do the study. Then results will come practically. That's why multiple drugs or multiple approaches and one target is good, sir. Actually, Ayurveda approach ko we have to validate, not Ayurvedic drugs. Whole approach. Arthritis है तो एक वस्ती देंगे, कुछ वो एक्सटर्नल देंगे, इंटरनल देंगे, डिसीज मॉडिफाइंग. हम शुंठी गूगल generally is not very anti-inflammatory. It is modifying the disease. Shunthi and another study example I will tell you in eye diseases secondary to the rheumatoid arthritis and SLE, scleritis, कुछ लोग आते हैं respond नहीं होता है treat. Then Indukanta Grutha is very good disease modifying. It acts like a immune suppressors use करते हैं arthritis में. This is immunomodifying. Actually, this is disease modifying. This Indukanta Grutha is very excellent disease modifying agent, particularly in arthritis and other autoimmune diseases, in psoriasis.
Yes.
It's disease modifying. That is, but we have to give oral treatment also in such diseases. Example, acute inflammation or acute inflammation with pain. Manjishta is really a good one. Pain immediately come here. Krishna Jirka, Nigella sativa. It's very useful. You give orally and you put some in external form. Some are, we have to put some हाथ में रखना चाहिए पेशेंट्स को रिटेन करने के लिए. एक्यूट में रखना जरूरी है. दैट इज़ वेरी इंपॉर्टेंट. ऑलवेज हमारा स्लो है नहीं बोल सकते. सम वी हैव वेरी गुड थिंग एंड ऑल. And these are practical black box design. I have already told you we can do it, and these are some examples. Somebody asked that I want to tell is, first we have to have some सम रेशनल, आप कुछ काम करना चाहते हैं, आयुर्वेद बुक पढ़ा, कुछ रिसर्च पेपर्स पर, सम मॉडल यू हैव सम थियरिटिकल बेसिस होना चाहिए। पहले स्लाइड में आपको देखने व्हाट हाउ टू गो अहेड ये बताया हमारा सर। सर आपका आई फॉरगॉट हिज नेम,
Pramendra.
हाँ
Pramendra.
प्रेमेंद्र, आपने कुछ बताया क्या करेंगे, हाउ टू गो अहेड कोई बोला। पहले ये करना है, सम नॉलेज वी हैव टू टेक, आफ्टर दैट वी हैव टू हैव ए प्री क्लिनिकल मीन्स एनिमल स्टडी नहीं, थियरिटिकल फ्रेमवर्क बनाना, हाउ वी टैक्स उसका तल्लिंगत्वात्, यू नो दैट दिस इज द डिस आगमाश्च, you have to prepare some conceptual framework and then do the small case series, छोटा मोटा 10-15 केस कर लीजिए आपने वो पीडी में। व्हेन इट इज गिविंग एफिकेसी डू बिग एक्सप्लोरेटरी स्टडी, बाद में बिगर स्टडी आप कर सकते हैं। व्हेन बिगर स्टडी में थोड़ा अच्छा हुआ देन वी कैन गो बाय इम्प्लीमेंटेशन स्टडी इन हंड्रेड्स ऑफ पेशेंट्स, रियल वर्ल्ड स्टडीज। दिस इज द आइडेंटिफाइड बाय सूटेबल फ्रेम, ये स्लाइड आप बाद में भी पढ़ लीजिए घर जाने के बाद। आइडेंटिफाइंग ए सूटेबल फ्रेमवर्क, सेम वट एवर आई हैव टोल्ड हियर, same thing I have put in the picture form, nothing is new। and theoretical framework होगा, एक case series develop करेंगे, बाद में you can do the small exploratory studies and then go for a bigger studies। this is the way how we can do the how we can go forward। suddenly we need not invest crores of rupees when we do something, if it is clinically effective on patients, go for the studies how it is acting, that is marker based studies, little expensive। sometimes we can do marker based studies in the beginning only, there is no problem, we have some how it is acting we can do, because some cases are rare। if you are doing diabetic nephropathy, good trial on 100 patients, उसी में मार्कर। प्रैग्मेटिक ट्रायल्स में हम क्या करते हैं, पेशेंट को जो चाहिए वो देते हैं, रिजल्ट करते हैं। इफ यू मिक्स बोथ, इफ रैंडमाइज्ड कंट्रोल ट्रायल में एलोपैथिक ग्रुप में वो दीजिए, ग्रुप में प्रैक्टिकली ट्रीटमेंट जो दे रहे वो दीजिए। ब्लैक द आरसीटीज को प्रैग्मेटिक को इफ यू आर एमालगमिंग देन देयर विल बी ए गुड मॉडल। एलोपैथिक वहाँ भी हम क्या कर रहे हैं, ट्रीटमेंट एज यूजुअल करते, TAU वो क्या एलोपैथी में क्या है, वी आर डूइंग ए स्टडी ऑन ग्लाइकोमा, आई एम डूइंग एज यूजुअल कंपैरेटिव टू अप्रोच। स्टडी टाइटल भी वो है, randomized controlled study of chronic simple glaucoma comparing the treatment as usual versus Ayurveda approach। ट्रीटमेंट एज यूजुअल, एलोपैथी में जो देना वो ही उनको देने दो, हम जो देना हम दे देंगे, एंड कंपेयर करेंगे विच अप्रोच इज बेटर, तब तो हमारा तो अच्छा ही आएगा। हम वैसा नहीं कर रहे, हम मेथड उनका मेथड अडॉप्ट कर रहे हैं। वो क्या है, उनका तो एनालिसिस कर रहे हैं, एलोपैथी में ब्रूफिन दे रहे हैं, हम तो हमारा दर्द इमीडिएटली उनका एक दिन में ही कम होगा, हमारा तो 2-3 दिन लग सकता है, बट एफिकेसी नहीं करके आ रहा है ट्रायल्स। आयुर्वेदा इज नॉट यूजफुल करके हम कितना भी ट्रायल किया ऐसा ही आ रहा है, देन वी चेंज दिस मेथड। ये मेथड अच्छा है, इजी भी है करना, ट्रीटमेंट एज यूजुअल वर्सेस आयुर्वेदा अप्रोच, दिस इज वन। अडॉप्टिव ट्रायल ये थोड़ा आप कर लीजिए, ये कर सकते हैं। फॉर अडॉप्टिव ट्रायल्स पहले आप कुछ कॉन्सेप्चुअल कुछ आप सोच रहे हैं, XYZ आप कुछ लेखना करना है, किसी में अर्म में किसी में करना है, वट एवर यू आर डूइंग सम लेखना और सिरा वेदना करना है, और जेलू काउचर में कर रहे हैं ग्लाइकोमा में इमीडिएटली प्रेजर करने के लिए, वो ट्रीटमेंट वो कितने बार अप्लाई करना जेलू का हमें पता नहीं, स्टैंडर्डाइज करना। फर्स्ट मॉडल है कंटिन्यूअल टाइप ऑफ अडॉप्टिव ट्रायल। आप पहले एक स्टडी कर लो 10-20 पेशेंट्स में, आप किसी में 1-2 बार लगाने से कितना इंटरवल में, डेली 1 बार लगाना, 2 बार लगाना, कितने दिन लगाने से प्रेशर कम हो रहा है, कम होने से कितने टाइम के बाद फिर एलिवेट हो रहा है प्रेशर, एग्जाम्पल बोल रहा हूँ, इट इज नॉट ग्लाइकोमा केस। देन इफ इट इज यूजफुल दैट इज अ कंटिन्यूअल मॉडलिंग बोलते हैं, उसके लिए कोई रूल नहीं है, आप कर रहे हैं, रिकॉर्ड कर रहे हैं, बाद में 10-20 पेशेंट के बाद आप ही खुद बोलेंगे सर ज़्यादातर पेशेंट में ये है। बाद में यू कैन डू द डिफरेंट टाइप ऑफ अडाप्टिव ट्रायल्स। स्टैटिस्टिकली वो है ना, सैंपल को वो करेंगे हम, कंट्रोल करेंगे। दैट इज अ डिफरेंट टाइप ऑफ स्ट्रैटिफाइड सैम्पलिंग मेथड। दिस सेकंड वाला मॉडल, यू कैन चेक द सेकंड मॉडल। इसमें क्या करते हैं हम, 100 सैंपल पहले लिया, एक ग्रुप 1 ग्रुप 2 में कितना सैम्पलिंग किया, बाद में वी आर डूइंग। बट एफिकेसी में वो क्या है, एक ग्रुप में थोड़ा ऐसा आ रहा है, थोड़ा वो कुछ एफिकेसी अच्छा आ रहा है और किसी में एफिकेसी नहीं आ रहा है, देन वी कैन चेंज द सैम्पल साइज। समटाइम्स वी आर टेकिंग 5000 पेशेंट का सैम्पल साइज लिया, हम 10 25 20 पेशेंट 100 पेशेंट्स कर लिया, एफिकेसी बहुत अच्छा आ रहा है सर हमारा आयुर्वेद ग्रुप में। कंपैरेटिव में ज़्यादा करने का जरूरी नहीं, तब 5000 पेशेंट सैंपल में 100 200 में हमारा तो अच्छा आ रहा है आयुर्वेद बट कंपेरेटिव लेवल। देन सैंपल साइज को हम रिसाइकिल करेंगे। सैंपल 5000 इतना जरूरी नहीं, हमें करेंगे थोड़ा सैंपल को 1500 काफ़ी है। देन स्टडी को चेंज कर लेंगे बीच में। इट इज़ नॉट दैट, एथिक्स कमेटी को बता देंगे हम, ये इतना जरूरी नहीं सर, कम में ही हो सकता है, पैसा खर्च कम होगा, काम भी ठीक होगा, काफ़ी है, एफिकेसी अच्छा। दैट इज ए टाइप ऑफ अडाप्टिव, जो हमको सूटेबल है वो अडाप्ट कर रहे हैं, बस कुछ नहीं। थर्ड टाइप ऑफ अडाप्टिव में व्हाट हैपेंस, इन वन ग्रुप वी आर गेटिंग एक्सलेंट एफिकेसी, बहुत अच्छा है ये। एक ट्रीटमेंट, एक ब्लैक बॉक्स डिजाइन किया, आयुर्वेद में 8-9 ट्रीटमेंट्स हम किया, एलोपैथी में एक ट्रीटमेंट किए, कंपेयर कर रहे हैं। वो एक ग्रुप में फॉर एग्जांपल ऑल पेशेंट्स में एक 2-3-4 ड्रग बहुत अच्छा इफेक्टिव है, हम सेलेक्ट किए, मन में रखे 10-15 रखेंगे, हर एक को अलग देंगे, बट सभी प्रकृति में एक अच्छा इफेक्टिव हो रहा है मान के चलो, बाकी को हम डिस्कार्ड करेंगे, वो ट्रायल डिजाइन को चेंज करेंगे, एक ही ड्रग को ज़्यादा करेंगे। ड्रग ग्रुप एंड एलोपैथिक ग्रुप कंपैरेटिव में, एलोपैथिक ग्रुप में कम करके इसमें ज़्यादा डाल देंगे पेशेंट्स को, हमारा तो इफेक्टिव दिख रहा है। दैट इज ए टाइप ऑफ अडाप्टिव ट्रायल, वेरी गुड ट्रायल। समटाइम्स प्रोग्नोसिस, हम ट्रीट करें डायबिटिक रेटिनोपैथी, एलोपैथी मोदर ट्रीटमेंट एज यूजुअल, लेजर करो कुछ भी, वट एवर ही इज डूइंग, हम हमारा ट्रीटमेंट भी कर रहे हैं, हमारा ट्रीटमेंट में बहुत अच्छा इफेक्ट नहीं आ रहा है मान के चलो। एक ना सेम पेशेंट अलग अलग होगा, कंपेयर भी कर सकते हैं, ऐड भी वो मॉडल भी बताऊंगे, ऐड ऑन भी बता दूंगा, बट इफेक्ट नहीं है तो हम भी ड्रग चेंज कर सकते हैं, बट हमारा ग्रुप में कम करके उनको रेफर कर। समटाइम्स एलोपैथिक ग्रुप में ज़्यादा एफिकेसी नहीं आ रहा है, हमारे ग्रुप में चेंज इट, प्रोग्नोस्टिक मॉडलिंग, प्रोग्नोसिस कैसा प्रोग्रेस हो रहा है ड्रग, तो वो इफेक्ट बयास नहीं होता है, बिकॉज दीज आर द रियल वर्ल्ड अडाप्टिव मॉडल्स है। बयास इसलिए नहीं होता है, हम पहले when we are doing a sample size 5, हमको क्या चाहिए, these are the outcomes, एंड पॉइंट्स को पहले देखते हैं ना, पहले मॉडल अनबयास्ड है, कोई इसी में भी बयास नहीं है। when you know that is not effective after 500, why we are putting the patients on the group which is not effective? जनरली क्या करते हैं, we stop the clinical trial ethically, मैडम, एथिकली वी स्टॉप द क्लिनिकल ट्रायल, इन्फॉर्म द एथिक्स कमिटी, हमारा इंट्रीम एनालिसिस करते हैं, रूल के हिसाब से 25% के बाद एक इंट्रीम एनालिसिस करते हैं, इंट्रीम एनालिसिस के बाद हम बोलते हैं तो ये इफेक्ट नहीं है, सर इफेक्ट बहुत अच्छा है, समटाइम्स इट इज़ टू मच इफेक्टिव, बहुत बढ़िया है सर, हम 5000 पेशेंट को कम करेंगे, इतना ज़रूरत है, 1500 में काफ़ी है, एफिकेसी ऑलरेडी, समटाइम्स इफेक्ट नहीं है, देन ग्रुप चेंज करेंगे, देन आवर स्टैटिस्टिकल मॉडलिंग में मिनिमम इतना पेशेंट चाहिए पहले ही हम कैलकुलेट करके रखेंगे, बट दूसरा में जब अडाप्टिव ट्रायल में चेंज कर रहे हैं ना, एवरी टाइम विल सी द फिर दोबारा कैलकुलेट करते हैं सैंपल से जितना हो सकता है, देन देयर विल बी नो बयास। दिस मॉडल इटसेल्फ इज टू अवॉइड बयास ओनली। हम वही बोलने में आपका ऐसा लग रहा है, जिसमें है तो उसमें प्रोग्नोसिस है तो चेंज करो करके, बट देयर इज अ मॉडल टू कैलकुलेट दैट आल्सो टू अवॉइड बयास। ऐसा नहीं है जिसमें नहीं तो रात के रात ऐसा नहीं है. We'll assess every time. We'll assess every time and see this. क्वेश्चन अच्छा है. बयास नहीं होना है, बट इसमें बयास अवॉइड करने के लिए N-of-1 ट्रायल्स मैंने बताया. एक बड़ा एरिया में चले गए हम, ट्रीटमेंट वल्लभगढ़ में हम कर रहे जेरेट्रिक. N-of-1 ट्रायल्स ये बहुत अच्छा मॉडल है मैडम. ये कंजंक्टिवाइटिस एपिडेमिक स्प्रिंग कैथ इसी में यूज़ कर सकते हैं. कम्युनिटी बेस्ड स्टडीज़ में N-of-1 ट्रायल्स यूज़ कर सकते हैं, ये बिग सैंपल में जो कर रहे. बट N-of-1 ट्रायल्स जनरली आयुर्वेद अप्रोचेस को वैलिडेट करने के लिए, जो अभी मैं बताया अडाप्टिव मॉडल, ये सब इसी में आता है. इसको N-of-1 ट्रायल करते हैं. वी गिव सम ट्रीटमेंट, पहले एक मन में रखेंगे, ये दे देंगे टू इम्प्रूव द क्वालिटी. एक मात्रावस्थी देंगे 7 दिन, कुछ जनरल हेल्थ के लिए रसायन ट्रीटमेंट देंगे, एक विरेचन देंगे, एक रसायन ट्रीटमेंट देंगे, इम्प्रूव द क्वालिटी ऑफ लाइफ. लाइन ऑफ वो करेंगे क्वालिटी ऑफ लाइफ के लिए. बाद में पेन के लिए मात्रावस्थी देंगे. इमीडिएटली वी गिव जेरियाट्रिक में बहुत प्रॉब्लम्स होता है, घुटने का दर्द, ये दर्द, पूरा सोच के एक बनाएंगे. करेंगे दिस इज कॉम्प्लेक्स अप्रोच करेंगे, हम करते रहेंगे. बस दिस इज ए गुड मॉडल. यू कैन आल्सो रीड. दिस इज इम्प्लीमेंटेशन रिसर्च, ये बता रहे थे वो तो इम्प्लीमेंटेशन रिसर्च. वो भी बता रहा है एलोपैथी आयुर्वेद क्रॉस रिफर करना है. हम एलोपैथी में क्या रिफर करना है, एलोपैथी से आयुर्वेद में क्या रिफर करना है, ये एलोपैथी के साथ आयुर्वेद ऐड ऑन कहाँ दे सकते हैं.
जैसे बताया ना सर कि ग्लूकोमा ट्रायल्स है, अभी हमने सुना 25 पेशेंट्स को एलोपैथी का ट्रीटमेंट चलेगा, 25 को अपन आयुर्वेदिक देंगे, देन वी कंपेयर.
ठीक है.
तो वो पेशेंट जो एलोपैथी लेगा फिर को हमारे पास आता नहीं.
इसलिए नहीं मैडम, वो तो मैडम वो सब करेंगे. दैट व्हेन वी आर डिजाइनिंग द ट्रायल वी आर गिविंग मॉडल हाउ टू गिव, वो तो है. एटलीस्ट वी गिव 1 to 1 or 2. जनरली एड ऑन एथिकली अग्री नहीं होता है मैडम. अभी वी वांट टू विथड्रॉ द ड्रग मीन्स एथिकली अग्री नहीं होता है. दिस वेयर वी कैन डू. फॉर एग्जांपल प्री हाइपरटेंशन वी आर गिविंग, हाइपरटेंशन वी आर NPCDCS में हमारे ट्रीटमेंट दे रहे हैं. जहाँ रेस्पॉन्स है वहाँ विथड्रॉ करना है, एथिकली विथड्रॉ करना है. बट ये क्रॉस रिफरल में क्या है, जहाँ हमारा ऑलरेडी एविडेंस है वो एलोपैथी के साथ. फॉर एग्जांपल कैंसर में दे आर गिविंग देयर ट्रीटमेंट, वी आर गिविंग द ट्रीटमेंट इम्प्रूविंग द स्लीप क्वालिटी, इम्प्रूव मैनेजमेंट ऑफ पेन एंड कॉम्प्लिकेशंस ऑफ द रेडियो एंड कीमोथेरेपी. एक बड़ा ट्रायल किया मैं CCRAS ने बनारस हिंदू यूनिवर्सिटी में. 400 केसेस फॉर 10 years फॉलोअप ऑफ कैंसर. बहुत वेराइटी ऑफ कैंसर्स एलोपैथी के साथ रेडियोथेरेपी आयुर्वेदा, कीमोथेरेपी आयुर्वेदा, रेडियो प्लस कीमोथेरेपी आयुर्वेदा. 10 साल के बाद देखा रेडियो प्लस कीमो प्लस आयुर्वेदा जो यूज कर रहे हैं उसका लाइफ स्पैन एक्चुअली ना इवेंट फ्री सर्वाइवल है तो जिंदा रहना, इवेंट फ्री सर्वाइवल है तो कॉम्प्लिकेशन के बिना सर्वाइव करना. व्हेन यू कंपेयर ऑल ओनली एलोपैथी, ओनली रेडियो प्लस कीमो हर एक से साथ है. व्हेन रेडियो कीमो प्लस आयुर्वेदा और radio plus ayurveda, when chemo plus ayurveda, when ayurveda is giving after 10 years follow complication event free survival है ना, at least an average of 6 to 7 years survival improvement rate था उसमें जो ऐड के. हमारा बेनिफिट के वी आर नॉट ट्रीटिंग क्यूरिंग कैंसर मैडम, वी आर गिविंग आवर ट्रीटमेंट टू इम्प्रूव द क्वालिटी ऑफ लाइफ, मैनेज पेन and happy quality life. Our target is not treating cancer, our target is treating manage the patient happily till he is survived. वो भी एक टारगेट है, वो भी एक. हर बार हम पूरा उसी को ट्रीट करना नहीं, हमारा गोल अलग होगा. किसी डिसीज में हमारा गोल ट्रीटमेंट नहीं होगा, इम्प्रूवमेंट ऑफ द क्वालिटी ऑफ लाइफ भी हो सकता है, वेल मैनेज, नींद भी आना भी है किसी डिसीज में. एग्जाम्पल बोलो, दीज आर द wherever we have strength we have to focus on those areas. ये क्रॉस रिफरल का भी एक डॉक्यूमेंट बनाया हमने, इसमें भी वेर आयुर्वेदा से एलोपैथी रेफर कर सकते हैं, इसमें आईडीसी ये वेबसाइट में है, आप पढ़ भी सकते हैं। इनमें आईडीसी जैसे ENT भी है, वेर हम उसको क्यों रेफर कर सकते हैं, वहाँ से कॉन्फिडेंटली हम क्या ट्रीट कर सकते हैं बेस्ड ऑन द रिसर्च एविडेंस। ये भी एक आप कभी भी पढ़ सकते हैं, घर में हमारे वेबसाइट में है, आप देख सकते हैं। वी डेवलप, ये तो हमने बताया फोक से कैसा। अब कुछ एग्जाम्पल बता दीजिए, बहुत एग्जाम्पल्स है, टाइम कम है। ड्रग इंटरेक्शन स्टडीज, कभी एलोपैथी के साथ हम दे रहे, वो बोलेंगे आपका ट्रीटमेंट दवा देने से हमारा ड्रग का एफिकेसी कम हो रहा है, इसलिए वी आर डूइंग ड्रग इंटरेक्शंस। एलोपैथी के साथ हम भी दवा दे रहे, उसका एलोपैथिक ड्रग्स का ब्लड में कॉन्सेंट्रेशन देखते, बायो अवेलेबिलिटी देख रहे। वी आर नॉट समटाइम्स एलोपैथिक ड्रग्स के साथ ये देने से एलोपैथिक ड्रग्स का एफिकेसी कम हो सकता है। फॉर एग्जांपल समटाइम्स फॉर एग्जांपल डिसीज मॉडिफाइंग थेरेपी, रोमेटॉइड आर्थराइटिस में मित्र, उसके साथ आयुर्वेदा देने से ना ज़्यादा इफेक्ट नहीं, ओनली आयुर्वेदा देने से बहुत अच्छा इफेक्टिव। एड ऑन टू द डिसीज मॉडिफाइंग आयुर्वेदा इज नॉट एट ऑल इफेक्टिव।
जैसे ग्लाइकोमा में तो हम
मिथट्रॉक्सिन अलोन मे बी ओके इफेक्टिव, बट आयुर्वेदा इज बेटर इफेक्टिव। मिथट्रॉक्सिन दोनों साथ में देने से काम हमारा ऑब्जर्व है, समटाइम्स इट इज गुड, समटाइम्स इट मे नॉट बी गुड। वो ड्रग इंटरेक्शंस का स्टडीज भी जरूरी है, बिकॉज एलोपैथी पीपल कैन कॉन्फिडेंटली रिफर टू अस, हम भी उनको रिफर करें। थोड़ा डेटा हम रखना जरूरी है हर बार, मैं कुछ पता है।
नहीं मतलब ऐसे यूवीआईटीज में है मेथोटिक्स राइट, वो भी उसमें भी देते हैं ना, तो दैट टाइम वी कैन सी,
हाँ
उसको भी हम अडॉप्ट
अडॉप्ट कर सकते। दिस आई टोल्ड ऑलरेडी, डायग्नोस्टिक मेथड्स हम किया, वो किया। दिस इज द 3 स्टडीज आई कंक्लूड। one is the study is the functional MRI we have conducted in Nashyakarma, 14 days में कर रहे थे, alternate day, and another group we have not done Nashyakarma in healthy volunteers, and we have done functional MRI and we see how the circulation patterns are, cerebral circulation patterns are improving. And after the study, we are interpreting still neurophysiological and other circulatory parameters.
EEG you have used, sir?
EEG है, functional MRI है, and dynamics है, वो blood flow का वो कर रहे। But we have checked that circulation to occipital area is improving in particularly occipital area. Why I am telling? This may be useful, but still we are doing. So it is improving in that in the diseases where actually the centrally acting whenever required. This may be useful. All areas is increasing, but occipital area में ज़्यादा improve हो रहा है. Wherever cerebral circulation is improvement is required, this can be done. Sometimes some diseases circulation को improve नहीं करना भी होगा. Bleeding होगा, cerebral intracerebral tanks. That time we should not also do. We should not increase the pressure also. Where to do, where not to do, maybe थोड़ा हमको correct नहीं है. Still we are doing. Just आपका एक information, but these studies are understand how we can do these things. Another one is in COVID where we have used, this is animal study. Hamster model is very expensive model, right? We have done Anuthaila, we have used through nose, we have infected animals, used used the Anuthaila, and after that infected animals. Some animals we have given Anuthaila, some we have not done, some we have not infect normal. What we have done, just when we give Anuthaila, beginning से ही दे रहे, उसको इन्फेक्ट किया, किसी को कोविड का ही, किसी को ऐसा ही इन्फेक्टेड एनिमल को पकड़ा है, किसी को हेल्दी किया, जिसको पहले से ही दे रहे अनुतैला, बट उसका उसी में जिसको ऑलरेडी इन्फेक्टेड है उसको भी इन्फेक्शन के बाद भी दे रहे, दोनों में वायरल लोड ना, वो वायरल लोड इज वेरी मिनिमल इन देयर टिश्यूज एंड लंग्स, बिकॉज इट इज अनुतैला इज ए प्रोटेक्टिव इम्यूनो म्यूकोजल बैरियर, एक कर्टन जैसा लगा दिया हमने, but infection can be prevented. This is a good study we have published. Second one, गलती से भी कुछ लंग्स में गया, बॉडी में स्प्रेड हो रही इन्फेक्शन, The viral load is very less, which may not damage much damage. इतना अच्छा था ये. But this is one study we have done. Example, this is how नशे कर्मा is acting. हम पढ़ाते हैं तो बच्चों को भी थोड़ा examples भी बोल सकते हैं. Just for because you are from teaching, some you can get all these papers मेरे research gate से कहीं मिल जाता है आपको. And required है तो दे देंगे. Another one. Every day we are giving नशे कर्मा. हम बोलते हैं डेली इंट्रानासल एडमिनिस्ट्रेशन ऑफ अणुतैला. ये तीसरा स्टडी है. दिस इज आल्सो पब्लिश इन हाई इम्पैक्ट जर्नल. वो बहुत अच्छा जर्नल था. तीनों गुड जर्नल्स है मेरे, इंटरनेशनल गुड इम्पैक्ट जर्नल्स में है. बहुत बढ़िया जर्नल्स है ये जर्नल में आप हम पब्लिश किया. तो इसमें क्या है, वी आर गिविंग अणुतैला एंड 7 डे एंड इसके म्यूकोजल बैरियर है ना, ये डाउन रेगुलेट कर सकते हैं. तो इसका इम्यून बैरियर, इम्यून एक इन्फेक्शन के बैरियर को कर्टन जैसा अच्छा बना रहा है. दिस इज आल्सो ए गुड एग्जांपल हाउ नशे कर्मा विल एक्ट एज ए बैरियर from the infection, improving the immunity, local immunity of the nose and preventing. These Nasha Karma, how it is useful as a curtain, improving the respiratory health, improving the cerebral pathology में कैसा करेंगे, wherever we can use. That's why Nasha Karma is very good option in Drishtigat Rogas also. And presbiosis is also, we are using sensor neural deafness and all. We are using a study, particularly we are using this. Nasya Karma, very good option, particularly in Drishtigat Rogas, where visual center and उसमें
क्या कर रहे हैं सर? SNSL में
क्या
SNSL सेंसर न्यूरल हीलिंग लॉस में क्या?
वो तो we have a different protocol किया. कर्णपूर्णा तो दिया है presbiosis में. We have given कुछ रसायन intervention दे रहे हैं for long run में. And we are doing some this one Nasha Karma we planned and for some days. How at least we are all parameters generally हम जो करते हैं वो कर रहे हैं. But and अभी ट्रायल कंप्लीट नहीं हुआ.
सर बस्ती का किया अभी बस्ती और उधर जगत होगा.
Which one मैडम? बस्ती तो देते हैं मैडम हम. Actually whenever I treat मैडम personally मैडम for diseases, for retinal and other diseases, most of the wherever we require regeneration मात्रा वस्ती तो हम 100% ब्रूहन देना ही है मैडम. Because when you are giving Triphala or Patoladi or some other Ghrutas or internally, even we give Jivan Tyadi Yamaka also Matra Vasti, we can give very good regenerative potential. Means generally we give 7 days देने के बाद फिर gap देके फिर देते हैं. But till we get improvement. But some cases particularly, Vasti alone is not very effective. We have to give internal also. Particularly wherever regeneration is required. And as per my experience, generally we can give Esedabasma is very good example. Esedabasma is very good common. You can give with anything. Eshti Madhu, Chekshusha ka ek drugs list आप रख लीजिए. Generally you try to put Guduchi and Esedabasma combination you can put, and with that it will be very useful because zinc is very neuroregenerative. And it also absorbs better into the retina, and it is very useful in preventing the regeneration. And इस zinc concentration retina circulation में अच्छा available होता है. It is one plus point
chemical
actually.
senses eye और nose का दोनों में देना.
अच्छा, it's very good actually. And other things, for example, Akshikukshamaya Pratishraya Navajjare Triratram Panchalanganam we do, but in allergic rhinitis. One allopathic physician I am sharing my experience. One allopathic physician, when we are doing internship in Andhra, he was giving allergic rhinitis and chronic sinusitis. What he is doing, he is just admitting the patient. He is giving protein-free diet for 7 days, 8 days. कुछ नहीं देते, apple और कुछ देता है, कुछ नहीं है, protein वाला. Then every day he used to do the distilled water enema. करते थे वो. करने से what is his concept? He has done some postdoctoral that day, olden days in USA or somewhere. He has some immunology. He told the immuno things we have to relieve from that's we have to remove the allergens and something from the body, and that's why his concept was there. After that, we are our principle is also same. Na? Then we have we are doing, but he's giving that what we have done. We keep fasting and we do virechana. He is doing distilled water enema to remove it. That is different one, madam. Whatever these things, new adaptive things, we have to need to adapt also. Not only teaching, but we can. This is very effective, madam. It's because all the diseases where the allergic pathology is there. Now our disease immunological component is there. This is always the virechana is very good effective, very efficacious, madam. And upavasa, that even in that serum, generally serum sickness is a different disease where different things are there. If you put that model of serum sickness for disease modifying diseases, where in the Kantagrutha how it works, modifying the body environment, and in that's why Ayurveda Charaka also tell Kuryat Sronita Rogeshu Raktapitta Harim Kriya Virekam Upavatasya Sravanam Sronita. But Virechana and Upavasa is very good treatment for chronic allergic component diseases. And neurodegeneration, Amal is very good. Amal ki rasayana is excellent neuro protective. Wherever I think for in the case of optic nerve, I cannot say how it is, but it is good. It is Amalaki Chakshusha and Amalaki Rasayana. 11-21 times potentiated Amalaki powder with Amalaki Swarasa. It's very good regenerative with along with Eshada. Basma is, you can try, man. It may not be successful. It is useful, but clinical experience we have not done any try.
So we have prepared a medicine for diabetic and hypertensive retinopathies. The Daru Bhakti, the Sanjan, the soap plus amla. Very good.
No, very good, madam. You can give.
Patient come and they take the medicine.
That's why I requested at least 10 cases को आप रिकॉर्ड कर लो, हमें दे दीजिए मैडम.
We have to go for the website. We have to.
मैडम अग्नि के लिए आप.
नहीं सर, इसके लिए बोल रहे हैं.
नहीं,
हमारा कुछ अग्नि.
अग्नि आप देने का अच्छा
नहीं अग्नि का नहीं सर.
प्रपोजल दे दीजिए. प्रपोजल आप मुझे बात करके बना के सीधा दे दें, बात करके दे. नो नीड टुगेदर डेवलप यू कैन. अग्नि फॉर पीपल हु हैव. आप कर सकते हैं. 10 केसेस का आप डॉक्यूमेंट कर लीजिए मैडम, काफी है मुझे. पब्लिश मत करो, एटलीस्ट 10 केसेस का थोड़ा हमें बता दो कैसा आपने. सिंपल, ज्यादा जरूरी नहीं.
हमारे पास पेशेंट आते चैलेंजिंग है आयुर्वेद में. चैलेंजिंग पेशेंट कम्स टू अस.
आने दो, मैं उसी को कर लेंगे ना.
क्योंकि वो सब कुछ हो चुका होता है.
ओके मैडम, फाइन. फाइनली द वे फॉरवर्ड मैं जो बताया तो वो अभी दो बार रिपीट करने में आप थक जाएंगे. बट आपको एक आइडिया होगा रफ व्हाट वी कैन डू एंड वी कैन प्रोसीड एंड वी कैन डू. थैंक यू मैडम.
Thank you once again, Dr. Shrikant.
भैया इसको
You have told me
बंद करो,
certain
निकल.
origins on the research potential in Shala ke front. We are open for any queries now.
Queries
If someone
बहुत
has any
nice.
query, then you can ask.
Directly outside. बस खुद जाना. नेक्स्ट सेशन वो ये
कर लिया.
ये करवा.
नहीं मेरा तो दूसरा
करना चाहते हैं. मैं मुझे नंबर
बहुत दिक्कत होती है.
शरद पवार का नंबर है. हाँ, शरद पवार हेल्प कर जरूर करें. 100%. बेटा आप अग्नि वाला देख लीजिए एक बार, कभी भी अप्लाई कर सकते हैं. ठीक है. बच्चों को कोई स्पार्क में छोटा मोटा आई वाला में देना है तो कॉन्सेप्ट दे दीजिए. उसको भी वेबसाइट में एडवर्टाइज, उसको 50,000 देंगे, उनके थ्रू आप ही करवा लीजिए. अच्छा है छोटा मोटा. एंड वी आर रेडी टू फंड. ऐसा नहीं 300 स्टूडेंट्स को देते हैं साल में. हम ऐसा नहीं देते, अनबयास लीजिए. आप अप्लाई करो, हम करते भी हैं.
हाँ बैड है।
हो गया ना?
एक से ये आपका है ना?
Thank you so much, sir.
इसको थोड़ा बंद
Now I would like to request Professor Shankar P.R. Swain to
Glass में पानी
come
दे
forward and welcome our
पानी
next
पानी
guest,
लेके
Dr. M. Prasad sir. Dr. M. Prasad sir. Ma'am.